Brilliant. Good morning, everyone. A huge thank you for joining on Carers' Rights. For those of you who don't know me, my name is Andy McGowan. I'm the Head of Engagement at the charity Caring Together, and I'm also the Policy and Public Affairs Advisor for the charity Our Time. So I'm really delighted to see people joining on what is obviously normally a very busy day in the carers world. If I can get the next slide, please. So just a little bit of housekeeping. So people can ensure they keep their microphones on mute throughout the session. We have got time for question and answer session later. But please, if you could also ensure that you're putting any questions or comments into the chat as we go forward. As I said before, please do introduce yourself, make use of the chat. It's a really brilliant networking opportunity from that sense as well. Any questions that either myself or the speakers aren't able to cover throughout the session today, we will make sure are followed up after the event as well. And just to say, in terms of, for those of you who are on Twitter, please do join in the conversation. So you can see that the Young Carers Alliance does have its own sort of Twitter handle, which is @YC Alliance. And the official hashtag for Carers Rights Day is, unsurprisingly, #Carers Rights Day. And just before we get started, just to give a bit of context in terms of who the Young Carers Alliance are, for those of you who aren't familiar. So the Young Carers Alliance is a network of over 125 organisations and over 350 individuals from a wide range of backgrounds. So from policy, from research, from local young carer providers to national organisations, to universities, to schools, all who've got one thing in common: is that commitment to improving the identification and support for young carers, young adult carers and their families. I'll be talking a little bit later on about sort of some of the work the Alliance does, but if you're not familiar with the Alliance before this event, please do check out the Alliance website, which you'll see the link later on as well. Just to give a sort of advance notice to say that unfortunately Paula Cruz from NHS England is sadly unwell this morning, so will be unable to join us, but I've got her slides and I'm familiar with quite a lot of the content, so I'll do my absolute best Paula Cruz impression from that perspective to cover some of the really helpful content about what NHS England are doing as well. But without further ado, we'll move on to our first speaker of the morning. If I can have the next slide, please. So absolutely delighted to welcome Dr. Rebecca Lacey, who's from the University College London. Just to say, in the joining instructions, you can see all the speakers' biographies, their full biographies about some of their backgrounds. But Rebecca's been doing a lot of work around sort of young adult carers in particular. And she's recently been awarded a Nuffield Foundation grant to look at the health, educational and social participation outcomes of young carers in the UK. And so Rebecca's going to be giving us a bit of an overview about the mental and physical health of young carers. What do we know from a research perspective? Thanks ever so much for joining, Rebecca.
Okay, thank you, Andy. It's great to be here. Thank you for the invite to speak. So I'm a social epidemiologist at UCL, and we're currently doing research on young adult carers and moving on to looking at young carers as well soon. And I'm going to present some work that we've done, which is a systematic review looking at the physical and mental health outcomes of young carers. So if I can have the next slide, please. Thank you. So before jumping into the review, I thought it'd be really helpful to firstly describe what a systematic review is and why those are important. So in short, a systematic review is a really comprehensive summary of all of the evidence on a specific topic. It's one of the strongest forms of evidence that exists. And this is because the review is conducted following a series of kind of rigorous and predefined steps that aim to minimize bias and maximize the kind of thoroughness and rigor of the review. It therefore provides a really thorough summary of evidence on a topic, and also in the review we also assess like the quality of the studies and the potential bias that might exist. So this forms part of our assessment of how good or strong the evidence is on a topic. So systematic reviews are therefore a really reliable source of evidence for policy and also for practice, as well as forming the basis for future research on a topic. Next slide, please. So before doing this piece of work, we realised that there'd been a series of systematic reviews that summarised the evidence on how being a carer as an adult affects mental and physical health. So these reviews showed that adult carers had on average poorer physical and mental health than adults who were not carers. But to the point at which we did this study, there was no systematic reviews looking at the health of young carers. And so the research on adult carers might give us some indication of what we might see for young carers, but we can't assume that the health consequences of caring in childhood or adolescence are the same as when that occurs in adulthood. We know that young carers have unique needs and that caring in this stage of life is much more unusual. We also know that adult carers are more likely to have control over their caring responsibilities and be more able to access various forms of support when they need it. So we set out to undertake a systematic review to kind of comprehensively summarise the evidence from quantitative studies on the health of young carers. Next slide, please. So in our review, we wanted to include all peer-reviewed academic studies, but also grey literature as well. So things like surveys and reports from charities or public health organisations. So we've searched 6 very broad databases to try and find these studies, and we've used a range of different search terms to try and pick up those studies on young carers. So next slide, please. So to be eligible for inclusion in our review, the studies need to be published in English. They need to be quantitative studies rather than qualitative studies. They needed to define young carers as those aged less than 18 years, which was consistent with that policy definition that's used, for example, in the Children and Families Act 2014. They need to include a comparison group of non-carers and to quantify at least one association between being a young carer and any measure of physical or mental health. So next slide, please. So we initially found 901 studies after I removed all the duplicates, and we then screened the titles and abstracts of these studies. So that's myself and a colleague who independently did that. This resulted in us having 25 full texts that we needed to then each screen. And at the end, we've ended up with only 14 studies included in our review, and actually 2 of those used the same sample of young people. So we've treated those as one study. So we had 13 studies in total kind of coming into the review. So next slide. So looking first at the characteristics of these studies, more than half of the studies we identified came from the UK, probably reflecting better awareness of young carers here. The rest of the studies were from various countries in the world, but notably all from high income countries. So we've got the Canada, the US, Australia and Austria, for example. And all studies, if you can just click again, sorry, I've realised there's an animation, that's it, thank you. All studies have been conducted relatively recently, so all except 2 were published in the last 10 years. And again, I think reflecting that increased awareness quite recently. Thank you, next slide. So most of the studies that we identified were cross-sectional, so they take that one snapshot in time, capturing information on caring and health at the same point in time. There was only one longitudinal study. So longitudinal studies are those that they have a stronger design because they allow us to ensure that caring precedes any changes in health. The samples really varied in size from sort of just a small, having sort of 40 people, right through to a huge 773,000 people. So very big variation in size of studies. Most of the studies look at mental health outcomes. There are fewer that looked at physical health. And sort of reassuringly, most of the studies that we identified were rated as high quality. So they had quite representative samples of young people, and they kind of sufficiently document their methods. So next slide. So what did these studies find? So first, if we think about mental health, all except one study found that young carers had poorer mental health on average compared to their non-caregiving peers. So they reported more symptoms of anxiety and depression, lower self-esteem, poorer health-related quality of life, for example. There was little evidence of kind of differences for boys and for girls, but studies did find that care intensity was important, which is probably not surprising. So if the young person was living with a care recipient, this was associated with worse mental health. And also if they were providing more hours of care per week, this was also associated with particularly poor mental health as well. Next slide. So in terms of physical health, as I mentioned, there were fewer studies that looked at this, but all of the studies that had looked at showed that young carers had poorer physical health on average compared to non-caregiving peers. So this was on a range of different indicators of physical health, from quite global measures of self-rated health, but also to specific, having kind of increased likelihood of specific physical health conditions and disabilities, physical health symptoms. They reported worse sleep and more mobility problems. And again, care intensity was found to be important, but actually only one study had actually looked at this. So finding that the more hours of care that young people were providing, kind of the worse their physical health was. So next slide, please. So what were our kind of conclusions and recommendations from this review? So we found, so our conclusion was that on average, young carers seem to have poorer mental and physical health than their peers, especially those young people that are providing the most intense levels of care. It's a relatively new area for quantitative research, and I think that probably reflects that we have kind of few existing data sets which actually ask about caring responsibilities in young people. And we clearly need more studies that look at being a young carer in lower and middle income countries. All the studies that we identified were from high income countries and in countries where there's relatively good awareness of young caring. We also clearly need more longitudinal studies, so we only found one. So these are as I mentioned before, the sort of strongest study design, and that we're able to ensure that becoming a young carer precedes any kind of differences that might result in mental and physical health. We also don't know a huge amount about how does being a young carer lead to worse health. So most of the studies that we included just kind of established that there's an association between how young caring and poorer health, but actually didn't look in any kind of detail about why that might be. And I think that needs unpicking a bit more. We also clearly need a lot more nuance in considering what care involves. So what activities are young people providing? What kind of level of intensity of care are they providing? So how many kind of hours per week? Because there's clearly going to be health differences as a consequence of that. Who they're providing care for is a really important thing as well. So whether they're providing care for a parent might be very different to providing care for a grandparent, for instance. And also importantly, the level of support that they're getting from various sources as well is something that we need to consider further. And then finally, just to say that all of these studies look kind of sort of more negative health outcomes, and it'd be great to look at some more positive outcomes as well to see what some of the potential benefits of being a young carer are as well. So not just having that kind of negative focus. Next slide, please. If anybody's interested in reading the review, it was published in September in Lancet Public Health. It's open access, so it's available on the web for anybody to access. You don't need to be an academic, for example. It's available for everybody. And the final slide. And this is the link to the study, which I'm happy to share the slides if anybody would like them, but also feel free to email me as well if you've got any kind of queries or comments. Thank you.
Brilliant. Thanks ever so much, Becca, for really sort of helping set the scene in relation to some of the impact on sort of physical and mental health. And it really chimes with what we've seen elsewhere. I know just yesterday there was a sort of a briefing came out from a study which is called the Cosmos study, which if people haven't heard of it, is one of those longitudinal studies looking at actually the impact of the COVID pandemic. So they've recruited a sample of 13,000 young people who are sitting their GCSEs. And again, they're going to be sort of tracking them over a period of time. And what came out in their briefing yesterday was that one of the questions they asked was, are people young carers? And in that, what we can see is that young carers are actually significantly more likely to psychological distress, they're more likely to self-harm, and also they're more likely to make attempts to take their own life as well. So it's such a huge issue, and I think we hear that so often around the mental health impact on young carers. So thanks ever so much, Becca, for really helping the scene. If I can have the next slide, please, Belinda. So next, I'm going to be handing over to Becky Rice. So Becky Rice is the Senior Policy Advisor for Mental Health and Wellbeing from Barnardo's. And she's been sort of doing a lot of work at the charity around their sort of the mental health policy, specifically also including young carers. And Barnardo's were very heavily involved in some of the campaign around the Health and Care Bill, which is now the Health and Care Act, to ensure that young carers as well as adult carers have sort of really clear legal rights as well. So I'm really pleased that Becky's going to be sort of here to talk a bit about in terms of the Health and Care Act and what it means for young carers. Thanks very much, Becky.
Thank you very much, Andy. I have just run up the stairs as some builders have arrived to fix a leak in our roof. I'm hoping you won't be able to hear them, but if I sound embarrassingly out of breath for quite a short run, that is why. Can I go on to the next slide, please? Yes, lovely. So as Andy has kindly introduced me, my name is Becky Rice. I'm a Senior Policy Advisor at Barnardo's. Barnardo's runs a number of services for young carers, everything from kind of respite and drop-in to helping navigate and signpost young carers across the system. And as Andy said, I'm going to be talking about the Health and Care Act and the impact of some of the changes in the Health and Care Act for young carers, particularly around hospital discharge. Next slide, please. So a little bit of context setting. It's obviously very difficult to know exactly how many young carers there are across the country. Young carers may not necessarily identify themselves as such or want to report themselves, and there is a wide range and wide variation across local authorities of reporting of young carers and identification of young carers. But we estimate that there are around 800,000 children, young people aged 5 to 17 providing care. And again, it's very difficult to know exactly how many are missing out on support, but we predict roughly 180,000. On average, young carers are caring for around 3 years before they're identified. We have had cases where that's been a lot more. And this is particularly concerning as young carers have their own support needs, which are often unmet. We've seen it's a short survey, it's quite a small survey of 1 in 3 young carers experiencing mental health issues, which is double the baseline rate for children and young people of 1 in 6, which is already, I imagine that you would agree, very high. Next slide, please. So hospital admission is particularly important as a young carer may come into contact with NHS professionals more frequently, more often, or solely compared to other professionals. And hospital admission is an opportunity to identify children and young people who are becoming a carer for the first time, to identify those who are already providing care and who are doing so without support, and to assess if children and young people who are receiving support need that young carers assessment updating as a result of the hospital admission of the person they're caring for. Next slide, please. In addition, of course, the admission of a family member or the person who a young person is caring for into hospital is a distressing time. It's often a time where young carers are overlooked. So that's during admission or discharge planning. Young carers may be left to look after themselves. They may be receiving less support from family members who are going in to visit. They may be unable to get transport to come and visit the person who they're caring for themselves. And this means that they're not a presence within the hospital setting. They may not be identified as a young carer, and they may not be involved in the admission and discharge planning. Young carers are often not included in discussions about the person who they're caring for's condition, whether that's changed on a temporary or long-term basis. They may not be involved in discussions about the recovery and rehabilitation of the person they're caring for, and they're often not consulted, and it's not discussed what the change in condition or what the hospital admission means for that young carer. NHS professionals supporting patients therefore need to take a whole family approach to the assessment and discharge of that person, whether the admission is elective, whether the admission is an emergency. And it's important to identify who is supporting the patient prior to their admission to hospital, how that support may have changed, whether that person needs support themselves during the admission and discharge. And this way young carers can be more effectively identified and engaged with. Next slide, please. So this isn't just a kind of moral imperative or a nice to have. Young carers' rights are now embedded in legislation. This was potentially under threat. The original version of the Health and Care Bill proposed removing the discharge to assess requirements for the NHS to consult with carers before discharge. This is clause 80. But Barnardo's and other organisations, including Carers UK, have campaigned for Amendment 113, which was originally placed in the Lords by Baroness Keithy, who is a Labour member of the Lords and supported across party by Conservatives and by crossbench, including Baroness Meacher and Baroness Hollins. And the amendment retains the duty on NHS and independent hospitals to ensure that carers, including young carers, are consulted as part of discharge planning. And that's both to ensure the safety of the patient and to ensure the safety of the young carer. And that amendment was accepted and is now part of the Health and Care Act, so it is a legal duty. Could I have the next slide, please? Thank you very much. So involving young carers now needs to take place from the moment of admission or prior to admission if it is elective. And that should take place, that engagement should take place right from the beginning. It should be consistent and it should be accessible to young carers in order to be effective and to avoid being tokenistic. Young carers should be identified as such and signposted for support and assessment where required. So that might be for a new young carers assessment, or it might be to update an existing young carers assessment. They should be informed of their rights as carers. They should be supported to understand the needs of the person they are caring for, and they should be able to express their capacity and their willingness to provide care. Next slide, please. Fab, thank you. So in practice, what this means for young carers is that they need to be engaged in a personalised way, need to have information and conversations which are accessible. So that may be through the use of language, it may be through the use of tools or resources, and ensuring conversations take place when a young carer can attend and facilitating that attendance if required. It also means we need to ensure young carers understand the information that they've been given, and young carers' needs and wishes should be taken into account alongside their need and ability to provide care. This includes considering respite, any equipment they may need to provide care, and holistic support for young carers according to their needs assessment. And it also means ensuring young carers aren't expected to perform duties which are above their age level, their physical, their mental ability, emotional ability, sorry, to do so. So next slide, please. So I think the best way to illustrate this really is with a case study. The writing is quite small, so I'll read this out. This is Bernardo's case study of a family who we've ended up supporting. And I think it just really well demonstrates current problems which can crop up in the system. Obviously, this doesn't happen for everyone, but in November 2021, following a short hospital stay after a stroke, a mother and her 13-year-old son were sent home with little information beyond being told that she would need a stroke clinic visit. Becoming a young carer led to her son being worried about his mother's safety and reluctant to go to school. There was no signposting for a young carer's needs assessment or wider support. So the lack of explanation about mum's condition and how likely it was or wasn't that she may deteriorate, and having no one to call, led to her son having unnecessary anxiety, attendance issues in school, and there was a lack of wider joined up thinking for that child acting as a young carer. Next slide, please. So the new duties in the Health and Care Act go beyond duties on hospitals and also provide duties for integrated care systems. Amendment 59 was championed by multiple children's charities, including Bernardo's, and places a duty on integrated care systems to assess how well the needs of children and young people are being met. NHS England will assess integrated care systems on their health promotion, their delivery of services, and successful integration for children and young people. The Act also creates a legal duty for integrated care boards, the strategic planning within ICSs, to consult with carers, including young carers, in the planning and delivery of commissioned services, as well as decisions about services relating to the prevention, diagnosis, care and treatment of the person who they care for. So this means there are multiple mechanisms for considering how to include young carers and should hopefully prevent them being an afterthought. Furthermore, the inclusion of children and young people's and maternity leave within an ICS structure helps to give leadership and accountability for young carers and the issues that affect them. Can I have the next slide, please? So we're very pleased that these amendments have been accepted and that they are now duties within the Health and Care Act. But legislation itself does not always create change, and that requires a cultural shift and prioritising a whole family approach to young carers driven by education. Senior leaders, NHS professionals, young carers all need to be aware of who and what a young carer is, and an assessment of their and of their rights to an assessment, to express choices on how much care they are willing and able to provide, and for those young carers who are over the age of 16, their right to support and work support and benefits. ICSs need to consider how to effectively identify young carers at a place level and how to create meaningful engagement in service design and delivery. NHS England has outlined 10 principles for how ICSs should work with people and communities, and under the umbrella of people and communities, young carers are included. Sorry, I've just seen a question, integrated, oh, Andy's answered it, thank you. So these 10 principles for engagement involve putting people and communities, in this case young carers' voices, right at the heart of decision making and governance. It means early engagement and feedback about how working with young carers has changed decision making and changed the activities of an organisation. Engagement needs to start early, and we need to understand what young carers' needs, experiences and aspirations are for health and care, both for themselves and the person that they care for. We need to build relationships with excluded groups, and I think in this case we can all agree that young carers are an excluded group we need to build those relationships with. We need to work with Health Watch, voluntary community and social enterprise sectors as key partners in engaging with groups, including young carers. ICSs should provide clear and accessible public information about the vision, plans and processes to build trust. Use community development approaches to empower people, including young carers. use co-production to achieve accountable health services, so allowing young carers to evaluate and feedback on services, and co-producing and redesigning services according to people's priorities. And finally, ICSs have a duty to learn what works and to build on what is already there in terms of their engagement. So I'm aware these 10 principles are quite woolly and quite difficult to maybe wrap your head around. So for young carers, what this means is that we need to consider which services young carers are using and who supports young carers within an integrated care system. So this includes charities, this includes services who work with young carers on a regular basis, and they should be engaged as part of an ICS's service planning and service delivery. And young carers should be engaged with directly. It means that an ICS needs to think about where young carers are, how to reach them, what that should look like in terms of resourcing and language, how they're fed back to so that they feel part of the discussion, and what is it about planning of services and which services should young carers be brought into. You have a risk with excluded groups of over-engagement and also of under-engagement. It means thinking carefully about building that relationship with young carers and making sure young carers are represented at every level, but also that they're not isolated, they're not the only voice representing excluded groups. So it's about coming together and having those relationships and the community approach to planning and delivering of services and to evaluating them. And that is what the Health and Care Act is essentially trying to do within ICSs. I think that's me finished.
Brilliant. Thanks ever so much, Becky. It's so helpful just getting that overview of what the Act means for young carers, because I completely agree. It's a brilliant opportunity in relation to young care identification and support, particularly from a healthcare perspective. But as you said, in terms of, there's no point if you've just got a piece of legislation that sits on the shelf if it's not being implemented in practice. And Trudy, just to come back to your point, that is something we're going to be covering later on in the session today. So thank you, Becky. And it's worth saying, just for young carer organisations on the call, in terms of, don't assume that your integrated care system and integrated care board will be aware of their duties in relation to young carers. I think what our experience has been is that when we've broached it in our local areas, is actually they weren't necessarily aware that they had those specific legal duties which included young carers, because obviously for integrated care systems, they only came into being on the 1st of July, and it's been a huge system change, joining of organisations, reorganisations. So I think there's been lots of things going on. So I think it might be really helpful just to make it really clear to them, actually, this is what it says from that perspective. And also this is how you can help them as the local young carer service. So thank you ever so much, Becky. Really, really appreciate it. And as I said, the slides will be shared afterwards. If anyone has got any questions around any of the work around integrated care systems, again, as part of the Alliance, we've got some really great organisations who are real subject experts in some of this, because it is a lot to get your head around between ICB, ICP, ICS from that perspective as well. Belinda, if I can go on to the next slide, please. So as I said, unfortunately, Paula Cruz is unwell this morning, so won't be able to be joining us. But I am going to do my absolute utmost to really give full credit to the work that's been going on around young carers. So I am going to talk to her slides. Obviously, if there's any questions that come up that I can't answer, then Paula said she's more than happy to answer them as well, and she sends her apologies. So if I can have the next slide, please. So just in terms of the context and just really building on what Becky said in the last session, why is this so important? Partly in terms of the scale. So obviously it's estimated that there's 800,000 young carers from that perspective. So working out to 2 young carers in every class, in every school from that perspective. But also we're seeing that many of them are hidden. So latest studies have shown that actually nearly 40% of young carers said that no one in their school was aware of their caring responsibilities, even though it has significant impact. So more than 1 in 4 secondary age young carers reporting that they're having difficulties at school or missing school because of their caring responsibilities as well. Okay, next slide, please. So earlier this year, Carers Trust, one of the national care organisations who are a member of the Alliance, surveyed over 500 young carers and young adult carers, and it really showed the impact it has on young carers. So more than half said the number of hours they spent caring had increased in the past year, but also just following on from the first session this morning about the impact on their mental health as well from that perspective. So feeling stressed, feeling worried, feeling lonely, but also having no one to talk to about how they're feeling, about their worries, about their caring responsibilities as well. And just to give a plug, just to say that the latest, the new young adult carers survey has just been launched in the past week or so. Last year, there were over 500 young carers and young adult carers who completed it. It'd be absolutely amazing if we could get even more young carers having their voices heard. I think the next year is going to be a huge one in the young carers world. So please, any support any of you can give to promoting the survey amongst your young carers and young adult carers would be really, really welcome from that sense. And as I said, I will send around the link afterwards as well if people aren't part of the Young Carers Alliance and get the weekly bulletins. Go to the next slide, please. So in terms of NHS's commitment to all carers, so this is something where NHS England have really set out, this is what they want to achieve for carers of all ages, and have been really doing a lot of work through the Commitment to Carers team to try and progress. So as you can see, it's about securing better outcomes of care for patients and the millions of people who care. So we've seen the numbers of people caring significantly increase throughout the pandemic. So it's likely that at some point, 3 in 5 of us will be carers at some point. Also to build a carer-friendly NHS to a much greater extent than there ever has been. And I think it's a huge opportunity. If we think about the one thing that every carer has in common, it's that they're supporting someone who's got a long-standing health condition or addiction or disability from that sense. So that person they care for is going to be in contact at some point with some form of health professional. It might be a GP, it might be around mental health, it could be occupational therapists from that perspective, it could be hospital staff, this could be a nursing. There's a whole range of people who've got that opportunity to identify those carers at the earliest point. And as Becky said in her presentation a moment ago, on average, young carers are caring for 3 years before they're being identified. But as Becky said, when we did a snapshot survey at Caring Together at the start of this year, there were sadly some young carers who were caring for more than 10 years without any form of support as a young carer as well. And so the NHS are really committed to building on it, so when no carer feels alone and that there is support for them through their caring journey. I did a conference locally for Cambridgeshire and Peterborough yesterday, and the carers were talking about saying actually they become carers, some of them overnight. Similarly, young carers may find themselves young carers overnight, and all of a sudden they've got to navigate a health and care system. They've got to understand and be an expert about the condition. They've got to understand about medicine management, safe moving and handling, all of these sorts of issues, as well as dealing with reduced sleep and impacts on their work or education from that perspective. Whereas actually, if you train to become a health professional or train to become a care worker, you have to go through a whole series of formal training and assessments and qualifications in order to get there. And the ultimate aim is making sure that young carers and carers of all ages are better able to look after their own health and well-being, as well as supporting the care of the person they care for, and less likely to go into crisis point. I think particularly at the moment, there is far too much emphasis on crisis response because we're only identifying carers when they get to that stage, rather than identifying them at the earliest possible opportunity as well. Next slide, please, Belinda. So NHS England set out a series of commitment to carers in their long-term plan. So you can see, so from 2020 to 2024, some of these commitments are just being reviewed in the light of COVID to make sure actually are they still sort of current from that perspective as well. I'm not going to read through them all from that perspective. You can see them on the screen here. And again, Paula and her colleagues will be able to send much more detail afterwards as well. But I will highlight some of them from that sense. So there's the introduction of the quality markers in secondary care, which is following on from the ones in primary care for GP surgeries that were launched a few years ago, to really improve the identification and support with that GP surgeries and now secondary care can offer as well. And we also hear quite often where sort of carers fall through the gaps. So in terms of where, okay, the school might know that they're a young carer, or their young carers provider might know that they're a young carer, but does the local authority have them flagged up? Are they known to their GP? What about if a person goes into hospital? So there's a big piece of work about being able to share their caring status with healthcare professionals wherever they present, via firstly an electronic health record, and then there is a bigger piece of work about shared care records as well from that perspective. And this is really key to try and improve that identification, but also take the burden off young carers. We know, speaking to young carers, they very rarely go and present to their GP about their caring responsibilities. So this means actually, in terms of day two, that actually the GP knows that they're a young carer. And so just to give an example of how this might work in practice, so in Cambridgeshire and Peterborough, the commission provider is Centre 33. And they've been doing a lot of work with the integrated care system and GP surgeries in the county there to help make it so that the record on the young carer's flag, on the young carer's record at the GP. So if that young carer does go to the GP, it automatically flags up and gives an alert to say, actually, this person is a young carer, check in how they are from that perspective. So that takes that burden off the young carer to ask or to mention about it. It means the GP has got that information ready to hand for them as well. Young carers have also produced top tips for GPs, and I'll be sharing about them later on as well. And it's also worth saying for those who aren't aware, NHS England have been doing a lot of work about what's called SNOMED codes. I'm not going to go into all of the details now, but these are basically consistent codes that are used on GP electronic systems to flag that someone is a carer. So they've got a single code to use that someone is a carer, whether they're a young carer or an adult carer. And so there's comms that's been going out to GP surgeries all over the country about these new SNOMED codes or about these consistent SNOMED codes. And again, a big piece of work to try and encourage that GP surgeries are using them. So we can see actually, again, how many young carers are there? How many adult carers are there from that perspective? So if you're a young carers organisation and you've not heard about some of the work about SNOMED codes, again, please feel free to get in touch and I can share you the information as well. What we can also do is NHS England have got a series of regional carer leads. I'm delighted we've got some of them on the call this morning, and their role is to really help embed the long-term plan in practice in their local areas as well. So if you don't know who your regional carers lead is from NHS England, again, please get in touch. I'll put my details in the chat later on and they'll be on the slides, and we can link you up with your NHS England regional carers lead, because they can really help your understanding about what should be happening, but also help with some of those conversations with sort of health colleagues as well. Have the next slide, please, Belinda. So on this slide here is just a whole series of links, which I'm not going to talk to. Those links are there and they'll be on the slide, which is a whole series of evidence around sort of the need to increase the recognition of carers, some examples of best practice from that perspective, and also more information about things like the quality markers that I talked about as well. So those are on the slides for people to have a look at their leisure. Next slide, please, Belinda. So one of the things that NHS England does do is the GP patient survey. So for those of you who aren't familiar with it, it goes to around 2.5 million patients. As you can see, in 2021, they had about 850,000 responses. And whilst this is only for patients aged 16 and over, it really gives a useful insight, particularly into young adult carers. And in the next few slides, I'm going to be showing some examples as well. And so this can be a really useful source of information about the experiences of carers compared to those sort of who don't have caring responsibilities as well. And as you can see in the question here, it doesn't just say, are you a carer? Are you a young adult carer? Because often what will happen is you'll get a very small number respond to that, because they'll see themselves as someone's brother, someone's sister, someone's daughter, grandson, parent, whoever it might be. So instead, it spells out in terms of actually who is a carer from that perspective as well. If we can go to the next slide, please. So the next couple of slides are just going to be giving just a few overview about some of the results that have come out as well. I've just seen a question in the chat about what time of year the GP surgery comes out. I don't know myself. I said, I've seen we've got Debbie Hustings on the call, who is one of the carer leads. She might know the answer to that. Otherwise, if no one else on the call knows, I'll make sure that we get the answer back to you as well. But as you can see, in terms of actually very few, and there's a significant number of carers who had no flexibility around trying to make it an appointment. And this is something we particularly hear from young adult carers can be really difficult, saying that actually in terms of if they've got college, if they've got work, if they've got an apprenticeship, actually they often need that flexibility when trying to make an appointment, either in terms of the times of the appointment or the ways in which they can make one. If you have to get the bus to college and you have to leave early in the morning, or if you start work at 8 o'clock in the morning, for example, and your GP surgery only has the telephone bookings where you have to ring up at 8 o'clock and join the queue, that makes it really, really difficult to be able to get that appointment as well. We can go to the next slide, please. But then in terms of their overall experiences, as you can see, there were disparities between carers and non-carers. So carers are the ones in terms of in the dark blue that you can see on the screen here, and then the light blue is one for non-carers. So as you can see, that there was a sort of disparity into their overall experience of their GP practice between 16 to 24-year-olds, so young adult carers, and also those who are just going into sort of adult life as well from that perspective. Similarly, in terms of good overall experience about making an appointment, just following on from what I was saying previously as well. But it's not just about GPs. We've seen locally, but also nationally, about actually experiences of dental services as well, and the challenges of accessing sort of dentist appointments from that perspective as well can be a sort of a huge impact. So I think the GP patient survey can be a really useful source of data to show actually what's the experience being faced in terms of nationally, but also in your local areas as well from that perspective. And as you saw, the largest disparity is seen within the overall experience of making appointments from that sense. Next slide, please, Belinda. We've talked about in terms of quite a lot already about the impact in terms of on mental health. And you can see here that half of carers entirely had a mental health need at their last GP appointment. It was one of the presenting issues from that perspective. But you can see this rose to around 3 in 5 carers in terms of that sort of 16 to 44. And you can see it's 60% when you're looking at young adult carers compared to 52% of non-carers. So it's a significant number of young people we're talking about here who are presenting with their mental health challenges. So I think we've worked around the 10-year mental health and wellbeing plan at a national level. That is so important to make sure it's really considering the needs of young carers and young adult carers. Work around mental health services being better at identifying those with caring responsibilities who might be presenting to them as well, but also just improving the general support that's available to them as well. If you can have the next slide, please. And then in terms of, you can see that actually a significant number of carers did feel supported by local services to manage any sort of long-term conditions, but actually younger carers were less likely to feel supported in comparison from that perspective as well. So again, I'm just sharing these as a few useful indications. As the whole slides will come around later on as well for people to sort of talk, to have a look at their leisure as well. Next slide, please, Belinda. And just say apologies if you hear anyone in the background. I've got a 4-year-old who's been off having surgery yesterday, so he's just sort of resting behind me. So if you hear any random noises, that's him in the background. As you can see, in terms of actually, again, just a whole range around sort of long-term mental health conditions were more likely compared to non-carers. In terms of also sort of carers in sort of 16 to 45 likely to report a breathing condition compared with to non-carers as well. But also in terms of actually just the impact on their day-to-day activity, in terms of what are they able to do. They manage to balance in terms of their caring with work, or their caring with employment and education, for example, from that sense as well. And just to give an example, so 78% of carers aged 16 to 24 said their day-to-day activity was affected, compared with 66% of non-carers. So again, still long-term conditions having a significant impact, but even more profound for those with caring responsibilities. The next slide, please. I've talked about from the Carers Trust Survey in terms of isolation, and this is something else that is really coming out in the GP patient survey. So you can see that so young adults or carers aged 16 to 34 were most likely to feel isolated as well from that perspective. And the difference between carers and non-carers is greater when you're looking at that younger age group as well from that perspective. Next slide, please. So in terms of actually there's a lot of data there, there's a lot of information being presented to you. Apologies, I'm not the subject expert on a lot of that, but in terms of hopefully it will have been useful just to see some of the areas that it's covering and bringing to light. But in terms of what are NHS England doing about it from that perspective? So I've mentioned that they've rolled out top tips for GPs. These have been developed by young carers. So these include things like access to preventative health and social prescribing, timely referral to local support services. And the aim is that by 2023 to 24, up to 20,000 young carers will benefit from this approach. So you can see here the top tips that have been produced. So this information has been shared with GP practices, and young carers have also helped producing in terms of videos and animations, and we're going to show some of them just in a moment from that perspective. But you can see what they've set out, and none of it's rocket science. So recognizing that they have individual needs, listening to what the young people are saying, not relying on young carer to interpret from that perspective. And again, talking about flexible appointments for them as well, just following on from what I was saying earlier in the data from the GP patient survey. If I can go to the next slide, please. So as I said, we are just going to share a couple of videos now in terms of just a couple of short clips around some of the top tips for GPs that have been produced and voiced by young carers. Belinda, just say we can't hear any sound. Apologies, we'll just pause. You might need to unshare and make sure it's got the sound option again, just in case that's unclicked out. My belief is it's not a webinar, if there's not some form of technological gremlins that interfere at some point.
As a GP, you're in a position where you're able to listen to young carers and make them feel heard. As a young carer myself, I never felt listened to when it came to what support I needed. Each young carer has the different needs and different supports that they actually want. And as a GP, it's your job to make sure you listen to them and offer support that you think is actually can be valuable to them. Offering the same advice to everyone may help the occasional few, but could also do a lot of damage and a lot of hurt to someone else. The next time you're with a young carer, make sure you ask them how you can help them and make sure they know what support is actually available to them. Taking a few minutes to ask a few questions can really help them in the long run.
Brilliant. Thanks very much, Belinda. So that was just a bit of a snapshot around some of the top tips, and we're just going to close this one down in a second, and we'll just go to the next one, which again is a short video, and these are sort of available to be shared at any point. So just bear us 1 second whilst we get the second video ready to go.
This isn't the one. This isn't it. Sorry, beg your pardon. Technical hitch here. Sorry, that's just. I need to come back to the presentation. Apologies for this.
In Belinda's defence, I obviously sprung this on her last minute in terms of that we'd be doing this particular slot from that sense. So just
bear with me. I've lost the escape. That's what I need to do. Right. Apologies.
Just checking, are you sharing? Oh, there we go. Perfect. There we go.
Okay.
Beyond. So next slide forward. And that one there. Perfect.
I think it's important that GPs know how to talk to young carers, and with that comes recognising that every situation is different.
Every young carer is different. We all have different caring responsibilities. You'll never meet two young carers at the same.
As a starting point, recognition can kind of lead on to so many more things. It puts some support in place and kind of put things in motion to actually help that individual and kind of make the situation more manageable.
I think no one really realises how much responsibility young carers actually have. So recognising that and then intervening with support, it really does help. That little recognition, it turns our lives around.
Brilliant. Thanks ever so much, Belinda. And whilst Belinda just gets the slides back up from that sense, whilst we switch from YouTube to the presentation, just say those videos are going to be available, and NHS England will be sharing them sort of publicly over the coming weeks from that perspective. But again, they're just a really helpful way in terms of sharing and raising awareness about actually what health professionals can do. So it's worth saying that if you don't have any local videos that you can use, do feel free to use them. And there's also ones where other Young Carers Alliance members have got some really helpful videos that they've produced to really raise awareness around young carers. And whilst Belinda just goes on to the next slide for us, please. So what can professionals do to support young carers in relation to identification and health? So as you can see, it's asking the question in the right way. And this is so important in thinking, actually, if the system just says, are you a carer? Are you a young carer? You will only ever get those who know that they're young carers or young adult carers. So actually thinking about how that question is wording, and it's worth saying that later on today, we're planning to share a film from Young Carers National Voice, which is a network of young carer organisations all doing a lot of young carers participation work across the country. And they've produced some resources and top tips, and that gives some example wording, for example, that mental health settings can use to help identify potential young carers, whether they're working with an adult or whether they're working with a young person as well. We've talked a lot about flexible appointments, so whether it's after school or having virtual or separate to the person that they care for, so they can look at their own needs as well from that perspective. But also doing things like checking in with a young carer. So if they're coming in and they know that they're a young carer, just checking in about how things are more generally for them from that perspective. And also encouraging young carers to register within primary care. So we saw a big uptake of that during the COVID-19 pandemic, particularly with young adult carers from that sense. But now with the new SNOMED codes that are in place, it's a real opportunity to raise that awareness, and so that actually that they can make sure that young carers know about what support's available from their GP surgery. So some of them might do a health check, some of them might access in terms of access to the flu vaccination and things from that perspective. Or should we, fingers crossed we don't, find ourselves in another sort of similar experience that we've had with the COVID-19 pandemic, it means that those young carers and young adult carers are identified at the earliest point if they do need to have priority to vaccinations and things like that as well. But most importantly, they can make sure they're linking into support as well. So linking into their local young carers organisation, making sure they're referring for young carers assessments. So as I said, they were in a really good place to identify young carers. And I'm just going to give you a couple of examples of where this has worked really, really well. So in terms of, for example, with an ambulance service, where a mum was being taken into hospital after a fall, her daughter went in the ambulance with her. And through that conversation, it transpired that actually her daughter was providing quite a lot of care for mum at home from that perspective. And so actually what that ambulance crew did is they didn't just say to mum, oh, go check out young carers when you get home from that perspective, or just look up young carers. What they did is, as part of their handover to the hospital, was actually said, we've had the conversation, actually we think that she might be a young carer. Here's the organisation. You make sure that you give the details to her before she's discharged from that perspective. And similarly, we had another example at one of the hospitals in Cambridgeshire, where a mum had been admitted into hospital because of a mental health crisis. And so she was doing sort of the plan around discharge for mum. But again, she was aware that she had a teenage daughter at home. And so she gave us a call at Caring Together and said, I'm doing mum's discharge plan and making sure there's support in place for mum, but I also don't want to discharge mum until I know there's support in place for her daughter. And those so far, they're the only two examples that I've heard in our local area, but it'd be amazing if we can get to a point where actually that is business as usual from that perspective as well. But also seeing actually, can you have a young carer or carer lead within your system? So within your organisation or in your particular setting, really helping championing the work around young carer identification and support as well. Can I go to the next slide, please? And to those of you who aren't familiar, in terms of if you don't know who your local young carers provider is, if you have a look on either the Carers Trust or Children's Society sites, you can find who your local carers organisations are. The Children's Society one is specific for young carers, where you can put in your postcode and it'll tell you all of the local young carers providers in your area. Whereas if you're looking for all ages, including young carers, Carers Trust can link you in with who the network partners are from that perspective as well. Can we have the next slide, please? And then in terms of this is just how you can stay connected to some of the work being done by the NHS England Commitment to Carers programme. So for those of you who aren't familiar, there is a platform called the Future Collaborations Platform. And this is where they will put sort of reports from sort of projects that they've done. So they've done a lot of work recently about underrepresented groups of carers. They have in terms of sort of webinar recordings, case studies, upcoming events. So I would really suggest signing up to the collaborations platform if you haven't already. They've got sort of bi-monthly lunch and learns on different topics. As you can see here, how you access that, the email address is in the chat, is in the slides as well. So again, apologies, I'm not Paula Cruz. She would have done a far better job than I have covering this content. But again, her email address is there. So if anyone does have any questions in the chat or any clarifications, please do drop Paula a line. And when she's back to work, hopefully next week, she'll be more than happy to get back to you as well. Have the next slide, please. So this is where I go back into my comfort zone, back to being the facilitator rather than the presenter from that sense. And so we're now going to shift focus to actually different ways of being able to how you can support young carers' health. So I'm really pleased that we're going to have sort of John Bangs, who's an independent carers policy advisor. He's been a real champion for young carers for a number of decades, never mind years from that perspective. And also we've got Jason White, who's from the Watford Football Club Community Sport and Education Trust, who've done some really great work about how they can play their part in supporting young carers around their health and well-being. So I'll hand over to John and Jason. Thanks very much. John, just check. I saw you in here already. Checking John's still here. See, John is in. John is in here. We're just going to. Hi, John. It looks like you're unmuted now. Can you hear me?
Yeah. Sorry, it's just at the wrong moment. This thing's gone weird. And right, can you see me now?
Yes, we can. Thanks, John.
Good. Okay. Good morning, and sorry about that. As you might gather, I know more about young carers, know more about football than I do about technology. So sorry for pressing the wrong button at the wrong moment. Thank you for the introduction. Yeah, I worked for 26 years for a local authority as a carers lead, but one of my other sad obsessions in life is Kingstonian Football Club, and this shirt I'm wearing, you'll see, is the shirt, is our club's shirt. And I think that evidence that is that small sports organisations as well as big ones can play a role. This is, I think, what our research colleagues would call grey literature. It's a simple survey of information gathering. We found, can we have the next slide, please? And then the next. So when we did a survey, found actually 24 organisations doing stuff, ranging from non-league clubs like my own Kingstonian and Margate from our league, up to Premiership sides like the community trusts for Manchester City, Manchester United, AFC Bournemouth and Brentford. So quite a range of different size of clubs. Next slide, please. So we published a report in June of this year, which I think possibly many of you will read. It's available through the slide or on the website if you need to go into it. Next slide. There are a wide range of things being undertaken, including things like stadium visits, providing taster sessions for football, regular coaching sessions, having young carers as to what guests to watch football matches, young carers as mascots, again, that's detailed in the report. And a lot of these things are very easy to do actually and to get going. Next slide. And next slide. We've seen in football quite a lot of social campaigning. Boris Johnson's government suffered few defeats, but actually 3 of them were inflicted on by 2 by Marcus Rashford and 1 by the England football team. So they've actually had a real role in challenging racism. Football's also, there's been work on raising awareness of mental health and homophobia. And we think the same could happen for young carers. Next slide. We've developed a partnership with Carers Active, and in April of next year, we're going to be working with them to promote sports opportunities in general. And that's what could I have the next slide, please? And the next slide. And the next slide. We're seeing a lot of evidence of this stuff being transferred to other sports. We've got an event on next week on the 1st of December where we'll be giving more information of that. about that. I've even actually had an email from someone from the USA interested in taking this up with baseball and American Football Little League. The stuff's very transferable. So if I could have the next slide. Want to focus a bit on social prescribing. There's a lot of the things that are fairly straightforward and obvious and have been found to work. At the start of the session, we had an interesting presentation from UCL where they'd found research evidence to prove what I think many of us have known, that caring can negatively impact both on the emotional well-being of young carers, their mental health, and of course their physical circumstances. And I'd venture to suggest, although I'm sure you're right that there should be more research in this area, it seems fairly obvious to people working in the field that this is to do with emotional pressure, emotional stress on young carers. It's due to do with lack of physical exercise. Also, I think being a carer means you have less time for undertaking exercise and physical activity, just as true for kids as it is for adults. So it affects young carers. And so I think these services demonstrably can help with young carers' health. Now, what's interesting to me is that one of the things we identified in the report was that there's potential for more to be done through social prescribing. And one of the various sports organisations who are taking this up are Watford Football Club through their Community Sports and Education Trust. And Jason, if I could perhaps ask you to say something about how you're getting involved in social prescribing. I know it's the start of your journey, but I think it's something really interesting and that others could learn from.
Yeah, hi John, hi everybody. As you've already indicated, John, it is early stages for us, but the Football Network for quite a while now has, so for those of you that are not aware, each football club within the sort of the Premier League and the EFL, of which there are 92 clubs, each of those football clubs has a charitable arm, and essentially those charitable organisations effectively work to support their communities, because ultimately a football club is owned by the community, really. So and what's happened over the last sort of, I would say, sort of 5 years really, is that football, and not just football, but certainly football is at the forefront of that, have become much more broader in the outcomes that they're looking to achieve. So much less about sport for sport's sake, but sport for broader outcomes, essentially. And increasingly that work is becoming much more aligned with the sort of statutory services, NHS, and social prescribing is a really an interesting and a natural fit really for football clubs like ours, because we are not only large community pillars, and so therefore very visible, but also we have lots of our own activities as well, which we can signpost and support people to engage with, really. And so for that reason, many football clubs, so we're not alone, are involved in this. There are a smaller number who are involved in young people social prescribing, but the NHS now regards social prescribing as an all-age initiative, and so we are one of those clubs that are one of a few clubs that are involved in that, and we receive funding through NHS charities, and we're learning more than we're getting right at the moment, is the truth, but we're excited by what we can achieve.
Yeah, so I think that's really good to see that happening, Jason. I mean, as you say, you're at early stages, social prescribing is a new route of access into community-based services. Obviously, people can direct access the things you do for children and young people. I mean, but they can. But this social prescribing provides a new route into the service, and that's kind of what we're testing, isn't it? To me, I think what's important to note is, I mean, I think we saw the figure of an estimated 800,000 young carers. Although this is probably fuzzy research rather than very hard stuff, we do know just factually that wherever people have worked within a school in intensity, they find far more young carers than are supposed to exist according to the census. So I think the 800,000 figure is about right. We've certainly know of schools where that level of numbers of young carers have been found when there's been detailed investigation. But if there's 1 and 3 in every class, if one thinks about the cohort of young people who are likely to actually access social prescribing, the proportion of the class who have got a well-adjusted home, plenty of money, no illness in the family, and not ever going to access social prescribing. So actually, of the cohort of people who are young people who are going to access social prescribing, there will actually be a higher proportion of that group who are young carers. So it seems to me to be a very good opportunity perhaps to identify hidden young carers. And I just wondered what your thoughts are on that opportunity, Jason.
Yeah, I mean, there was a couple of things that you said there that made me kind of think about previous examples of work we've done. I mean, you know, I found when in a previous role at a different football club, I led a piece of work around the armed forces, and that was really quite interesting journey to go on, because quite quickly in that journey, I discovered that many agents, the similar issues exist there, which is many people don't necessarily overtly identify as being a carer or a young carer or being from the armed forces community. And so one of the first things we were able to do then, and again, these are things that we can possibly look at here, was simply by adapting our registration form to ask whether the individual themselves or any of their direct families had served in the UK British Armed Forces. And straight away we unearthed all of that, and I know it's on the census now. So I think that where we're at, specifically in relation to young carers, is you know, what we're good at is we're good at engaging, and we're good at building relationships. And I think that previously, or prior to the sort of the conversations you and I have been having, John, you know, we've not asked that question. Now, we do need to be careful around what questions we can ask and why, but equally, it is likely that we, as you've indicated, would be able to identify young carers, and therefore, and then that's what's really that's what is so really interesting about social prescribing, though, because, and look, social prescribing is a word, and it's definitely evolving, and it's much more mature now than it has ever been. But equally, it is still something that most of the third sector have been doing for a long while, and statutory too. But what is at the core of social prescribing is that multi-agency way of working. And I think that's really what's interesting, and why we feel as though possibly, you know, working with carers and developing streams of work around this cohort is quite interesting as well, because the suspicion is, and we're still very much at an early stage in our understanding, but the likelihood is, just by the basics that we kind of know, is that there may be a number of people who, because the pressures that they're under, that they're unable to access other services or get the support that they need. And that support might just be peer support. It might just be having a friend to talk to, or it might be having something to look forward to. But working in that multi-agency way, which is definitely where we're trying to become more multi-agency in our thinking and doing, and that's where social prescribing it sits. So there's an awful lot we can do, and hopefully engaging and identifying more carers is at the top of that list.
Cheers, thanks so much, Jason. Could I have the next slide, please? And the next. So, if through our partnership with Carers Active, there seems to be the potential to develop lots of new community-based services of the kind we've just heard about with Watford Football Club. So I think the message is, do talk to your local football clubs, charity arms, or smaller organisations. It may be the club direct itself, but also to check with people in your area who are working on social prescribing, actually that firstly they've got young carers fully on their agenda, and help them to make sure the social prescribing services are carer aware, young carer aware, carer friendly, young carer friendly. Really important. Don't assume it to be the case. And then if there are local services of the excellent kind we've heard from Watford, make sure they know about them. Next slide, please. So we've highlighted some opportunities for development which are published in the report. Next slide. Next slide. Some of them I think are fairly obvious. You can read them. One I just wanted to touch on though is the research thing. And as I said earlier, we do need to find a way of through the alliance of getting the powers that be who fund research to fund some more research in this area. I mean, there's, for those of you who are old enough to remember the three wise monkeys who heard no evil, saw no evil, and speak no evil. There's a great tendency for commissioners of research traditionally, less so now for adult carers, but still really for young carers, to hear no young carers, see no young carers, speak no young carers. If you don't do any research, it becomes a foregone conclusion that you've only got grey research. So we do need to campaign for more research to actually evidence the benefit of this stuff, and then and also to shift the approach, to develop perhaps further the approach of Sports England and the Football Foundation to make this something that funding is more clearly available on. So that's it really. Stuff is all on the website. If people are interested in taking up these kind of initiatives, please do contact the Alliance or contact me direct, because we're very happy to help with local conversations about making more stuff happen. As I was taught to say when I was little, thank you for having me. That's the end.
Brilliant. Thanks ever so much, John. And you finished right on time from that perspective as well. So I tip my hat to you for that one. And it's so useful because I think there's so much great work going on from that perspective at the moment around sort of young carers and sport. We're seeing lots of examples. If you haven't seen the report, please do check it out on the Young Carers Alliance webpage as well, because there's just so many different examples which shows it can be done. And it's not just the big clubs who've got a lot of money from that perspective. We're seeing lots of smaller clubs as well from that sense as well. So thanks ever so much. And again, if people are interested in this topic and want to hear sort of many more examples, if you can come along to next week's webinar on Thursday the 1st from 1:30 till 3. I put the link in the chat earlier. I can also repeat it later on as well. That'll help you to hear some more examples about what's been going on and think about what you can do in your local area from that perspective. If I can have the next slide, please, Belinda, and the next one. So we're now going to hand over to Kelly Hockaday, who's the Young Carers Coordinator from the Manchester Young Carers Partnership. And so Kelly's got the sort of job of sort of helping lead on their young carer strategy and the implementation of it within the city. And I think it's fair to say, I think Manchester is in those areas where I'm regularly looking to as to what work they're doing around young carers. There's some really great through partnership work going on. So it isn't just one organisation, it's got that partnership between education, health, local authority, voluntary sector, and the wider, and most importantly, young carers and young adult carers. So I'm going to hand over to Kelly, who's going to talk about some of the work they've been doing around identification of young carers. Thanks, Kelly.
Thanks, Andy, for that really nice, glowing introduction. So yeah, I'm Kelly Hockerty. I'm the Young Carers Coordinator for Manchester City Council. And this was a role that was established in 2019 and was seen at the time as quite radical because the council took a very difficult decision following quite extensive research with Manchester young carers to decommission standalone young carer services. Now that might not work in lots of other local authorities, but we're seeing a lot of headway in Manchester. I think just to hit on something Jason was saying before, it's around that multi-agency working and that call for everybody to work in true partnership. And what we've certainly seen prior to 2019 is a lot of disconnect and a lot of hidden young carers because of that lack of knowledge and that lack of understanding. And it was around, they assumed that a service, which we all know, and certainly are fantastic organisations that solely work with young carers, can't be the answer for all young carers and cannot possibly meet the entire needs for their local authorities. So my role was developed in 2019 and we've done quite a lot of work with our young carers, specifically of all different areas, but my talk with you today is around the health. We're at a really exciting point at the moment where we're working with our partners at Healthwatch to develop a toolkit, and this is completely co-produced with lots of Manchester young carers. So just to give you a snapshot, we have over 188 schools in Manchester. We've got just short of 140 schools that now have a named young carers champion in that school. We have young carer leads in each of our 3 early help hubs, including our social work teams as well. So there's lots in terms of the practical embedment and raising awareness of who young carers are to kind of identify our hidden young carers. So one of the big things I did when I took the role is to gather our young carers and talk about what they felt was important to them. So specifically through a series of open letters, over 100 young carers wrote to social workers, early help, tutors, teachers, and then they also wrote a letter to health. So could I have the next slide, please? And if we could press play on this, this is the Dear Healthcare Professionals, which provides the foundation for our approach in health.
Dear healthcare professional, I am a young carer. I know your main focus is on my loved one, and I appreciate your care for them. You understand their medical needs and the healthcare they require. As a carer, I spend a lot of my time with my loved one. I know them very well, and I am there through all of the ups and downs. This can be hard as I don't always know all of the medical terms or how things work in the medical world. When we see you, I have some questions, but the appointment isn't for me, so I don't always have the confidence to ask. I want to be included. If you speak to me, I can tell you a lot about them. I can tell you how they've been sleeping, how much they have eaten, or if they've had a fall lately. I'm a good advocate for them. I can also notice signs that may mean their health is a worry. If I am contacting you, or have been referred to you for my own health, I may not tell you right away that I am a carer. Sometimes my caring role causes me stress and worry, and sometimes at other aspects of my life. It's helpful if you know about my caring responsibilities, as you can understand me better, but it doesn't automatically mean something is wrong. I am proud to be a young carer, and I look after my loved one. They trust me, and I know exactly what they like and dislike. I will just need your help to make sure it doesn't get too much, and I get the help I need to keep caring. Please ask about my caring role if I come to appointments with my loved one, or if I'm at home when you visit. My role is important to me. Please point me in the direction of any help I can get for my caring role, or even just for me. Remember, I am a young person too, and I will put others first, so checking in with me helps when I find it difficult to reach out to others. I want to stay well so I can do the best caring I can. We will make a great team working together.
Thank you. So that was a collective voice of lots of young carers from across the city, and we think, it speaks for itself. They're not, to say what Andy was saying before, it's not the moon and the stars that young people are asking for, and certainly our young carers. It's about being included and respected, and actually seeing from a unique young person's perspective what the care system's like. And that's something, I'm assuming we're all over 20 on this call, is that we do kind of lose touch with, regardless of whether we've got our own young children, what it's like to be a young person in today's world. And it's very, very difficult to navigate, and that's without that added responsibility being a carer. So this led to some really kind of eye-opening work, and we started with our school nurses, and that was to dovetail the work that's taking place in our schools, like whole school assemblies, letters home to parents, those kind of things. And so school nurses are currently going to be helping us develop just some check-ins, because something that's really surprised me a little bit in Manchester is that even though our professionals are amazing at what they do, they still lack confidence about how do I ask these children the questions? How do we phrase it in a way that's not going to cause any distress or harm? How do we do it in a way that you know, is safeguards the confidentiality of the person that we're looking after, but also make sure that young person's being heard and getting their needs met? So we did some training on that, and then we've got some young carer leads in the school nursing system, but also with our CAMS partners as well, to kind of get, you know, it's a massive machine, Manchester, and it's kind of trying to get all the cogs oiled and working together, and we are seeing some benefit of that, though, like I say, it's not without challenges. Could I have the next slide, please? So we wanted to obviously improve young care experiences. One of the key drivers for this was the findings of the GP survey back in 2018. Some really glaring concerns around young carers feeling invisible in GP surgeries, or feeling intimidated by GPs in white coats. For GP surgeries not being the most friendly or confidential reception spaces. So we looked with young carers at how we would be the best ways to address this. So we are looking at the moment, we've got 88 surgeries across Manchester, and we're pleased to say we recently attended a conference with those GPs, introduced young carers, and we've got massive appetite from staff who want to be included in the Young Carers Toolkit for practitioners that we're doing at the moment. Our aim is to make sure that there's a lead for young carers in the surgery, and I think what's really important about this might not be a GP. This might be somebody who's got a carer champion role within that surgery, who's been a carer themselves, and it might be somebody who works on that reception desk. But it's somebody who's met with me, the coordinator, who knows the pathway to support and has that passion and that drive, and they support the GPs, and that's been really valuable in Manchester. They then deliver a briefing to all staff members to look at you know, sensitive conversations, indicators that someone's a carer, and lots of different awareness for posters and promotions. They look at putting in a whole practice agreement, and what we don't do is stipulate exactly what that must look like. We work on the premise that our GP surgeries know their communities, they know their you know, patients. So it's about building it with their views rather than, you know, we can give them some ideas, but we allow them to build with their own patients through questionnaires and whatnot, whatever they want within their surgeries. Support for sensitive conversations for the cared for, including the young carer. We work very closely with, like I say, Manchester Health Watch. They did a big survey on GP websites during the pandemic around accessibility. And what we're pleased to find is that lots of our GP surgeries are the link to the Manchester Young Carers, but there was very little way to engage the younger audience in terms of pathways to support. It might be very difficult for a young carer to call a GP surgery, and often it might be through text or through a web-based page that that'd be their preference to getting in touch, or discrete boxes within GP surgeries that they can pop in a card that highlights that they need to be supported. We're looking, like I said, with our school nurses and school teams to look at routine health screening. So it's really is about the preventative and not the reactive. You know, social prescribing, which we've heard quite a bit of today, is so important and is often overlooked. It's, you know, the resilience and the well-being, what keeps that young person well, what is it that really allows them to have time and explore opportunities outside of their caring role that they have interest in, and that are not about you know, that blueprint of being a carer. And then all our surgeries are linked with early help hubs. Like I say, we have 3 in the city and are well connected. Next slide, please. So this is just an example. We have a terrible website called Help and Support Manchester. So it's fantastic as it is in functionality. The look of it's quite bland. It's something we're trying to work on. But this is Rakana. She's one of our young carer champions at a local GP surgery. She was a young carer. They've got posters now around the surgery. They've got a quiet corner space where young people can go and sit if they want to be identified, for somebody to go and have a chat, or if they're going in to support the person they care for, that they've got a quiet space. But also what's been really interesting, she'll contact me and say, what's the best pathway for this young person? They're not yet at the stage where they want to come forward for an assessment, but this is kind of, you know, so we're embedding that confidence and model of support so that there is a truly a no wrong door for our young carers. Also we get calls from the surgery to check, is this person a young carer? This is what we've seen, and we give that tailored advice. And we've also got, we don't have detailed time, sorry to go into detail today, but lots of resources that can be used by lots of professionals with either little or lots of confidence, or even by the young carer and their own families, to help them look at the preventative, what to do in emergency, what to do if someone's hospitalized, and importantly, how to keep well, keep safe, and to keep managing and self-scoring that to see how things are. So there's a lot of the work that's taking place in Manchester. Don't really want to go over my time, so am I still on time here, Andy?
You've got about 2 minutes left.
Right, wonderful. So next slide then, please. These are obviously the references for our the detail on the slide, and then I think Andy's going to show over the break. We've been involved in a project, something that we hear quite a lot from Manchester carers, and it's become a campaign called Support Not Sympathy, is that there's far too much emphasis, and this sometimes pushes young carers to be hidden, on the harmful aspects of caring without enough focus on what's the resilience and what benefit a young carer gets from caring. And actually the message that caring becomes that burden of responsibility and harmful when it's inappropriate levels of care or that young person's left not identified. And I think another thing, and I always kind of try and plug this side myself, was a young carer, and it's just recognising that sometimes the images that we put out there to do good, to raise awareness about young carers, can sometimes be harmful in terms of young carers becoming hidden because other parents, say, don't identify, or young carers don't identify with that image, or are often some of the things I've seen where children are in really inappropriate caring roles, and that can lead to some really negative stereotypes. So if we've got a child that's got a parent with epilepsy and they've seen them have an epileptic fit, they don't necessarily identify that they're a young carer because they're not doing any cooking, cleaning, things like that. So it's just us all kind of being mindful. So Young Carers in Manchester did a video called Support Not Sympathy, and what they wanted to do is show the life of a hidden young carer, but then the difference by being not hidden and just having those kind of sensitive responses, not changing, not giving anything different other than recognizing they might need that additional support in different areas, right from peer friendships to health through to youth and play. That video has been shortlisted, so it's Carers' Rights Day today, and I'm super excited. That's why I look lovely. I've got to get ready for a big function tonight. We're at the there's a laughter from Andy there, that was a bit rude. We were at the Manchester Culture Awards, and they've made finalists, so fingers crossed. And if anybody wants to use this resource, please do share it. And that's it from me.
Brilliant. Thanks ever so much, Kelly. I'm just jealous that you get to go to a fancy do this evening from that perspective. So thank you ever so much. It's so helpful. Just I think the amount of sort of partnership work going on in Manchester is really brilliant from that sense. As Kelly said, we have got the link to the film. What we're going to do is we are going to go into a comfort break. So in terms of what we'll do is we'll start the film in a second. So we're going to go for a comfort break till 11:40. We'll be able to make up a little bit of time later on. Don't worry, so we'll still finish on time. So the film's about 5 minutes long, so there'll be still time to grab a drink and stretch your legs after the film if you want to watch the film first as well. But then if people can come back for 11:40, and then we'll go into the second part of the session, please. If Linda comes to the next slide, so on the next slide is the link to the film. Put that one there. Just make sure that starts playing properly. Oh, we haven't got any sound coming through again, Belinda.
You might in a minute. It's a little bit fixing.
Thanks, everyone.
I'm sorry if it rains and I feel down. There's always a rainbow behind the clouds. It sometimes feels strong and I feel proud. When life gets tough, I won't let me down. On the good days, I feel greater. It gets tough sometimes, but it makes sure I believe, yeah, I succeed, yeah, I am human. I will battle through the day. I'm no worries and I'm okay. I am powerful. Sometimes things are not okay. I'm a hero through the days. I am powerful. Sorry if my life is hard to say, but I need your support, not sympathy. Help me to be strong and to be proud. When life gets tough, I need you around. You don't know me, I'm a story. I get down sometimes, but I'll make it. I achieve, yeah, I'll succeed, yeah, I am human. I will battle through the day. I'm no worries and I'm okay. I am powerful. Sometimes things are not
Welcome back, everyone. Hope you managed to stretch your legs and have a quick comfort break. And I completely agree. I'm really pleased to see such powerful messages and response in the chat. I think similarly, I've seen lots of young carers videos over the years, but I think that's done in such a creative way to show just how much of an impact small sort of measures can really make from that perspective. So we're now going to have another practice example now, where we're going to be sharing just again some of the work being done to improve identification around of young carers within healthcare settings. So I'm really pleased that we've got Kate Anderson and Scott Biddle here, who are here from Family Action Young Carers Project in Windsor and Maidenhead, and they're going to be talking about some of the work they've been doing as part of a lottery funded project as well. Thanks very much.
Okay, good morning, everyone. I'm Kate Anderson, and I work with Scott Biddle in the Family Action Young Carers Health Team at Windsor and Maidenhead. Just to give some background, I believe the uptake of referrals through the healthcare sector was so poor in the area that we were taken on and employed to try and help increase the rate of referrals, and that was back in April. So we've been in post 8 months, so we are really at early stages of our work here, but Scott's going to carry on by taking us through what we've done so far in terms of research, and then I'll take you through some of the barriers that we've discovered, and Scott will finish off by talking about where we're going and what we're planning to do for the future. Thank you, Scott.
Hello. So next slide, please. So what have we done so far? So we've begun researching a number of government papers. I have literally just come out of university and completed a degree, and my dissertation was on Hear Me, See Me and Support Me, Please Do Not Forget Me, and that was all about the impact of care on young carers. So the 4 acts that we were looking at to start with was the Children and Family Act of 2014, the Care Act of 2014, the Young Carers Needs Assessment Regulation of 2015, and the Carers Act of Scotland 2016. And I can't remember off the top of my head if I mentioned this further down in the presentation, but with Scotland, young carers are consulted at every single part of the care when it takes to a young person being in hospital, cared for being in hospital. So that's from the discharge to the admission, right through to actually, is this young person able to support the family within the home? So that's that kind of thing. And then we looked at the Carers Act, the whole family approach, and that's the 2015 one. And then we had a look at the carers, supporting carers in the general practice, a framework of quality markers. Next slide, please. And then we went on to look at some of the forums and young carer services that have done this before us, so that we could kind of support and have a look into what works well, what hasn't worked well, and if things do work well, why am reinventing a wheel that actually works for us. So we met with the Gloucestershire Young Carers and the Buckinghamshire Young Carers, the Carers Together and the Carer Friendly TIC, and Carers Trust were the 4 main young carer services that we met with and really got an in-depth dive of how they support young carers within hospitals. And then we linked with our forums. So we've got the National Young Carers Alliance Forum, we've got the Healthcare and Wellbeing Forum, and we have the we went to the Health and Wellbeing Forum of the Royal Borough of Windsor Maidenhead and presented there. And we also presented at the Disability Inclusion Forum within the borough as well. So we are slowly starting to push our name out there and get families on board and trying to understand. But also within this, we have established our own forums. So we now established a healthcare round table forum. This table is basically all the care leads and care coordinators within the Royal Borough of Windsor and Maidenhead that come together every 6 to 8 weeks, I believe it is. And what we do is we sit down and we really just hash out everything that we need to know about how we can support young carers in the borough and how we can do it well. The Young Carers ambassadors. So they are young carers that have been through our service before, and they come together and they do a year's program. And in that year's program, they learn skills such as public speaking, and they present at shows and stuff for us, so that it's the young person that is getting their word out. It's not coming from us. And then we've got the Young Carers Parent and Carer Forum. So that we've only just launched. We've had our first meeting, and I head that up. And it is really beneficial to get a holistical view from the young carers, from the parents, and from us, and from professionals, to try and support that whole family approach as much as possible. Next slide, please.
Okay, thank you, Scott. From the Healthcare Roundtable, we've identified barriers that we feel young carers come against in trying to engage with the primary care services. And just very briefly, time for professionals. Time is a big factor. The time for professionals to explore the wider family support. When they're meeting with patients, how much time do they have to really understand if there is a young person caring for someone in the family? Invisibility is a barrier, just young carers not being seen. We've touched on a lot of these issues already this morning. Lack of confidence or willingness to self-identify. Lack of awareness of the role of young carer by professionals. Some young carers just take it that this is their life, this is normal, that they're not doing anything out of the ordinary, and stigma and shame sometimes, fear of the implications of a caring role being publicly acknowledged amongst professionals or the community. Language and terminology used by professionals can be a barrier, and staff turnover, because the turnover of staff can be so quick that it takes time to train people up and make people aware. Just going back to the lack of confidence or willingness to self-identify, we've had examples of the term young carer being a barrier to young carers coming forward. And I've been aware more recently of the different perceptions that young carers have of this term. I've heard of young carers being relieved to be identified as a young carer, because then they know that they're part of a group and they can belong to a group where they can get help and support. And other young carers not wanting to be called a young carer, and not liking that label, as it were. And that for me is a big thing about trying to do something in terms of communication within the community, to sort of something about that term as to what the benefits, promoting the benefits more than the struggles maybe and the challenges. But move on, next slide please. Thank you Belinda. So time and invisibility, some of the potential solutions and actions that we have implemented or proposed to support being implemented, to ensure that there's targeted direct questions on healthcare professionals' assessment forms in our local area to actually ask if there is a child in the household. Again, it's already been touched on about the ICON, the code, the Young Carers Code on the GP's database. I understand there's the SNOMED codes, and Andy's referred to, that are being sort of being made more aware of through the GP community. So it's improved use of electronic databases. Parental consent requested when we do our assessments now. We ask for parental consent so that we can send out a letter to the GP to make the GP aware that in that family there is a young carer, and that will help with identification on their database to help improve and make more efficient the referral pathways to try and help young carers access services for support. And we're looking at training and induction of professionals and CPD sessions, particularly for healthcare professionals. Next slide please, Belinda. Thank you. So invisibility and lack of confidence. As the fact that we're here, we're trying to engage more in regional and national forums, and to try and learn about what's already being done and what's already being researched, to help us to sort of provide a strong foundation for our service in Windsor and Maidenhead. We're looking to promote the benefits and positive aspects of being a young carer while supporting young carers to equip them to be more vocal and independent. For example, through working directly with them and through group work. We offer one-to-one sessions with young carers, and we offer a Level Up Wellbeing programme, which takes place once or twice a year for juniors and seniors. And we're looking to try and develop young adults carers wellbeing service, and Scott has raised for us within our service about what we are offering for younger carers. We're talking about trying to identify young carers at an earlier age, but what services are available to young carers, say aged 5 and 6, for example. So we are looking at that. We try and signpost and help young carers access external support services, working in partnership with services within our local community, for example, esteemed youth groups, and putting young carers in touch with young carers champions and training and recruiting more young carers champions. We have many. Well, I say we have many. We have made a really good start to have a lot of them in the schools, and we're looking to improve that for the healthcare professionals. Next slide, please, Belinda. Thank you, Andy. Lack of awareness to provide opportunity for discussions with families, targeted communication resources and distribution of marketing material, and continuous ongoing professional development there. And we have an annual celebration event. Next slide, please, Belinda. And the stigma and fear, beg your pardon, for young people, young carers and their families. So looking to review practice and tailor training sessions, establish the forums for discussion and training more young carers. Thank you, Belinda. Next slide, please. Over to you, Scott.
So we're going to whistle-stop tour through the next 4 to 6 months. So we're going to be talking to the hospital discharge teams and GPs, and we're going to start a GP roadshow. We're going to attend GP surgeries. We're going to push young carers out as much as possible to all we can go, and try and get their name out and about. We are going to, so as I said there, we've spoken at the health and wellbeing forums and the disability forums. We're going to continue access and support directly for these young carers and their families, because again, the referrals are coming through slowly, but we still need to get that support there. We delivered a minimum of 2 young carers wellbeing groups per annum, which is for seniors and juniors. And if you would like some more about what Level Up is, then please do email us. Our email is on the next slide. And we're developing a young carers group, which is for age 5 to 6. And then we're going to talk about our young carers ambassadors. And then finally, we're promoting ourselves in media spaces around our local newspapers, our newsletters, and all that support that we can do there. Next slide, please. So there's just our email addresses there for you. So if you've got any inquiries in terms of referrals, then the email address is rbwm.yc@family-action.org.uk. And if you have any questions about forums or any of the work that we're doing, then Kate's email and my email is there for you to direct emails to us. So if there's any questions, please do put them in the comments, and I'll endeavour to try and answer them as well as Kate.
Brilliant. Thanks ever so much, Kate and Scott. It's really great just to hear how that model works, having a sort of dedicated team focusing on this health engagement from that perspective. And there's a whole programme of work going on. So people, please do get in touch with Kate and Scott if you want to hear any more from that sense. So our next example, next slide, please, Belinda, is going to be Belinda herself. So in terms of Belinda, just going to be talking about some of the great work that she's been doing as the Awareness and Voice Team Manager, particularly with around sort of young carers in Norfolk. So without further ado, I'll hand over to Belinda.
Thank you very much, Andy. Yeah, so as Andy just alluded to, I'm the Awareness and Voice Team Manager across Cambridgeshire, Peterborough and Norfolk, and we do lots of awareness raising work in healthcare settings and have had some really great successes over the last couple of years, which I just wanted to share a really quick whistle-stop tour with you around that. So some of the work we've been doing with healthcare services across Cambridgeshire, Peterborough and Norfolk to raise awareness of young carers has been so vital. We know that healthcare professionals are really, really well placed to identify situations where there might be a young carer by asking, the patient about their family situation, any young people living in the house, and that's been alluded to in many presentations prior to this, so I won't go on about that too much, but just to give you a bit of an overview about our awareness raising sessions. Obviously, the sessions we deliver encompass all carers, so that's young carers, parent carers and adult carers, but we really focus on the potential impacts for children that might have a caring responsibility, and for those in some cases who are in fact the primary caregiver as a child, and ensuring they are recognised as such and are actually included in conversations, all of the conversations from admission, but crucially that discharge. And again, it's been alluded to before, that they are consulted around whether they are happy to continue with their caring role, or if they're able to, really making sure they're consulted at every opportunity. So you can see here we've been able to engage with a number of healthcare professionals. We regularly deliver sessions to acute hospitals across Cambridgeshire, Peterborough and Norfolk, and we've also had engagement with a number of GP practices. So our carer friendly tick, I won't go into detail about that, but a couple of people mentioned it earlier, having that introduction with them, really selling the importance of young carer awareness and their staff being aware and identifying them, and then consequently delivering staff training, which has been really beneficial, and we've had great feedback around that. The East of England Ambulance Service, so they have a DOS, a Directory of Services. So we sit on a, oh, sorry, I beg your pardon. Yeah, we were fortunate enough to be able to link in with the lead for the person who manages this, and I managed to get a meeting with him, and really wanted to look at how well populated their carer support button was. So this is for ambulance crews who are looking for a service to help signpost to if they come across a young carer or any carers in general. And what we found when we were in that interview is the only service that was populated under the carer support button was Age UK. So really, really pleased to say that that's now much more populated. So we worked with our partners, our network partners, to really make sure that all of those services were embedded in there. So that carer support button is now much more well populated, and lots of services there for the ambulance service to direct carers, young carers to. So we in Norfolk have, we have a young carers steering group with lots of subgroups off that, and I sit on the health and education ones of those. And during the health one, we were very brilliantly given a contact for the head of learning at the 111 service. So obviously this is the service you call as opposed to 999. We all know what that is. So I had a meeting with the learning development manager and pitched the idea that we could do an awareness training session to their clinicians, not the people that answer the phone, because they have to stick to a very strict script. But when they're handed on to a clinician, training those clinicians to have those professionally curious conversations, asking about other members in the household, and we delivered that session, and they were really, really pleased with it, and said, could we do another one? And that one was then recorded, and that's now live on their learning management portal for all of the clinicians to be able to access. So we're really pleased with the outcome of that. We've also been able to deliver sessions to student social workers, student nurses, and also this year for the first time delivered to trainee occupational therapists at the Anglia Ruskin Faculty of Health. This session was so well received that we have been invited to come and do this annually now moving forward. All credit to Andy McGowan, because it was actually him that delivered that session for us. So that's a really great outcome too. We now have a rapidly growing number of healthcare settings we've supported to be carer friendly, including the 0 to 19 Healthy Child Programme. So they've had the carer friendly tick now for 2 years and have done lots of amazing work. They just had their, or last year they had their reapplication approved. So they've had the Carer Friendly tick now for 3 years, which is just fantastic. Of course, all of the work that we do, raising awareness of young carers, is done so with the voice of young carers at the heart of everything that we do. So we have something in Norfolk called our Norfolk Young Carers Forum. So they are a parliament, a committee, if you like, of very vocal and passionate young people who meet and come together to talk about the issues and impacts of being a young carer in Norfolk. So all of the work that we do, all of the presentations that we have, they are all done with the voice of those amazing young people being fed into that, to make sure that we are getting it right and what we are delivering is what they think is important. So that's really great. And also our Norfolk Young Carers Forum, they've got such a great high profile in Norfolk. They do lots of consultation work with NHS England, Health Watch, Children's Services, the Education Department. Any literature in Norfolk that there is around young carers, you can almost bet that it's probably come through Norfolk Young Carers Forum for co-production and consultation. And we were able to get a audience with the Chief Executive of Norfolk and Waveney NHS Integrated Care Board, a round table with them, talking about the issues and impacts of being a young carer in Norfolk, and ensuring that young carers, all carers, but particularly young carers, are on the agenda for the ICB moving forward. And that is now on there. Again, such an amazing outcome. James's story, it is embedded in there, Andy. I don't think we've probably got time to play it, have we?
No, we won't have time, but again, it's one which will be included in the presentation. So.
No problem. Just to give you a quick overview, so one of our Norfolk Young Carers Forum's members is a primary caregiver for his mum and had quite a negative experience at the Norfolk and Norwich Hospital. However, the Norfolk and Norwich Hospital, when James eventually got through to the patient experience team, they really listened to what he had to say and really thought, you know what, we need to learn from this. And they created, hats off to them, you know, they put their hands up and said, we could have done better. Look, this is a story that occurred. This is James's story. They made it into an animation. It's really, really fantastic that, you know, they're doing their best to learn from their mistakes, which is a really great example. So if you do get a chance at some point, please do have a look at that. Thank you, Andy.
Brilliant. Thank you so much, Belinda. That really is a brilliant whistle-stop tour of just the great work that's been going on, and absolutely echo what Belinda said. I think please do. I will in a second put a link to James's video into the chat. It's a really powerful animation about his experience and particularly around hospital discharge as well, which we know is really timely. Come to the next slide, please. So as Belinda's just getting the slides back up, given she's gone from presenter mode into sort of the technical wizard for us from that sense. Really delighted and grateful that Fiona Rogers from the from NHS West Yorkshire Integrated Care Board and the West Yorkshire Health and Care Partnership has agreed to come along and speak. Because again, I think there's been some really brilliant work in terms of as an integrated care partnership going on, and particularly making sure that young carers are at the heart of this from that perspective. This integrated care partnership actually won the integrated care system of the year at the Health Service Journal Award. They've won it for the second year running now, so there's clearly got some great stuff to be shouting about from that perspective. So I went to a webinar recently which was really powerful about some of the work they've been doing, so I'm looking forward to hearing what Fiona's got to say. Thanks, Fiona.
Hi, thanks very much, Andy, and I'm delighted to have been invited here today. I apologise for my croaky voice, but I'll hopefully get through the next 10 minutes. Next slide, please. I'm not going to give loads of statistics, and we've had lots of those already this morning, but I think just giving a little bit of background about West Yorkshire. So we have a population of 2.4 million, with children accounting for approximately 23%. And the last data that we received was that we had about 1,500 young carers registered with Young Carer Services, which I think we know is a massive underestimation of the number of young carers that are out there. Across our partnership, we have a combination of VCSE services and local authorities that provide our services. Next slide, please. The work I work in the long-term conditions and personalisation function, when unpaid carers is threaded through that whole function. I'm not going to read through this whole slide, but I think you can see, if you pick out some of it, is that one of the aims is to support patients and carers to be better informed, to support and manage their care and access to support, to drive a population health improvement approach across the partnership, meaningfully addressing health inequalities across West Yorkshire, and influence commissioning decisions and processes at place and through provider collaboratives. Next slide, please. This is just to show you our unpaid carer system aspirations for 2022-25, and I think it's just to demonstrate to you. You'll see in the orange there, that's our young carers work stream, increasing awareness and support for young carers. But we also work with working carers, primary and community care, working with the hospitals, recognising carers as experts in care, and also the health and wellbeing of carers. And I've just been promoted to be programme manager of this programme, having spent the last 2 years being the Young Carers Programme Manager. Next slide, please. I'm going to show you now a couple of the projects that I've been leading in my project management role. I think Andy just mentioned there, one of the ones that we've just launched was our Young Carers Film Project. We know that young carers report that they feel unrecognised and identified. So we co-produced with a group of our young carers a series of short films that could be used across health settings to raise awareness of young carers, not just across health, but across all settings. And also combined that West Yorkshire was aiming to be a trauma-informed system by 2030. So we happened to hear that they were piloting some trauma-informed guidance for co-production, and we volunteered to use our project to pilot this. And we were the first project in West Yorkshire to use this guidance that we're really proud of, putting young carers at the forefront of new guidance. Next slide, please. The feedback from young carers was that they felt the setup was cool, the place was awesome, it was an amazing experience being part of the film project. I'm not going to read every one of these, I'm well aware of the time constraints, but I think you can see in the pictures there, the young carers had fun. They thought we had gentle voices, calming, we weren't bossy, which was great to hear, welcoming, honest and kind. And they felt that it made them feel special and important, and that other young carers could relate, and they felt like a celebrity. And the reason we've got little Oscars there is because when we did the presentation and celebration event, we presented each of the young carers with an engraved Oscar, thanking them for taking part in the project. Next slide, please. The feedback from the project team was that from one of the young carer leads, you can see there with me. Thank you for championing these young people and helping them to have a voice and be heard. Means such a great deal to people, and knowing Dan, who was one of the young carers, and his mum were proud and welcomed the opportunity. The production company, interestingly, felt that they had to be more flexible and responsive, and they felt it actually turned the production process on its head, and that the young people had ownership in this project. And if you're able to show Dan's story now, that'd be great. Thank you.
Oh, Belinda, it's just the link at the bottom of the slide.
Can you show the film, Belinda?
My mum suffers with fibromyalgia and chronic fatigue. It's quite difficult to keep my head, in the game, focused, because knowing that my mum could have fallen or it's just, lying there hungry, it makes me feel a bit frustrated for her, knowing that I'm not there to help. I caught myself drifting off once in an English assessment where I couldn't think of any answers. I know my mum's okay, but I just can't get it out of my head. A few of my teachers are actually fully aware of what I'm going through. It's really nice when teachers say how's your mum? It's just nice to know that there's someone there that knows what I'm going through and that's asking me how my mum is. It makes me feel happy inside, really, and just glad.
Thanks, Belinda. And I think I just want to say that those films we've got 5 short films with 5 young carers from West Yorkshire, all sharing their own stories. And there's also a 4-minute film with 15 young carers, all sharing their stories. So intentionally made short, snappy, so that they could be used. And we're hoping that, as I say, they were only launched last month. So we're hoping that those are going to be shared across the system in health, education, safeguarding training, everybody's training, and everybody's able to use them. They're available on YouTube and also on our website, and I can put the link in the chat. Next slide, please. Another piece of work that we've been working with the Health Focus is the primary care resource packs. And the ask was to co-produce a bespoke resource pack of information in each place. And this work came originally from North Tyneside, and to support professionals working in primary care to identify, signpost and support unpaid carers, including young carers. Next slide, please. This is an example of the pages that are within the document. We've got 2 pages about young carers, and as you can see here, there's loads of information, loads of links. There's links to our own websites, there's links to national guidance, there's links to safeguarding. Next slide as well, please. Also goes on and includes the top tips for GPs, and also talks about young carers' assessment of needs. The idea is that each place across West Yorkshire, we have 5 places, and I've been leading a project with each of those 5 places to produce a bespoke pack with primary care that has relevant information and facts for all those primary care professionals. We've launched them in different ways across the partnership. We've been really fortunate that we've been given time at the primary care protected learning time events. So we've been able to present directly to those people working in primary care the benefits of identifying young carers at an early stage and being able to use the primary care resource pack. Next slide, please. Another piece of work that we're working on with the Health Focus is a personalised care approach to discharge planning. We know that unpaid carers' lived experience demonstrates there can be positive experiences, but also experiences where there's been room for improvement. And we know that young carers often feel that they're not involved at all in discharge planning, even when they're the primary or sole carer. Next slide, please. So the benefits that we're looking at is it benefits to the young carer. Thanks, Sandy. I've got 3 minutes left. To the young carer, to the loved one hospital services, and you can see the other bullet points there. Next slide, please. And the best practice to inform the work that we're doing, you can see there, really looking at this through a personalised care lens. Next slide, please. The actions that we've got in progress are that we're scoping local and national practice, and fabulous to hear today some of the great work going on across other places in the country. So I'll definitely be getting in touch. Part of the research project in the North East, working with our own Young Carers Steering Group, our Unpaid Carers Steering Group, Voluntary Sector Network, and our Unpaid Carers Clinical Lead Groups, seeking lived experience through our networks and involvement from our stakeholders in acute trust, community services and primary care, and looking to co-produce a set of principles. Next slide, please. Some of the other projects that we've been involved in the past, you may have seen these previously on Twitter. We've got Tom there, one of our young carers. He wanted to be on a billboard in his local shopping centre to promote young carers, so we did it, and here he is last year. We also produced a young carer support app, which I appreciate. We haven't got time to show you a film, so Andy, if we can miss that film, if that's okay, to get back some time. And then also last year we produced an e-cookbook with young carers too. Next slide, please. And I think just to finish off, co-production is at the heart of all we do in West Yorkshire. And this is a slide from Tom when he did a presentation with me, and I've pinched his slide to share with you today. And what he says here is that whilst working with a team on projects, he's gained a lot of skills and improved on some he already had that he'd learned throughout his life. Some of those including team working, communication, building confidence, time management, research and IT, problem solving, building presentation skills, creativity and focus. And I think some of the work that I do, it's great to feel that we're actually supporting young carers in their life skills and being involved in the work that we do. Thank you very much, and I'm happy to take any questions in the chat.
Thank you ever so much, Fiona. Appreciate it. I give you a challenge to try and get through as much as you're doing in such a short space of time. But again, some really great sort of genuine co-production work going on in West Yorkshire as well. So I've put a link to the app in the film in there as well. Apologies. So if I go to the next slide, please, Belinda. So we're now just going to show into another example of some work being done from that perspective as well. So I'm really delighted that Claire Flanagan has agreed to come and talk about some of the work that's being done to support young carers' health and well-being up in Scotland from that perspective. So I'll hand over to Claire.
Thank you very much. Hello, everybody. I can zip through this. I think a lot of the things on my presentation have already been discussed this morning, so it's kind of reassuring to know that we're all in the same boat. Next slide, please. So I'm fairly new to young carers. I've only been in post for about 7 and a bit months. So I suppose from that perspective, I've come in with fresh eyes and a blank canvas, and it was really important to me to look at the data and evidence that was available so that I could prioritise our actions in South Ayrshire. I took evidence from 2 reports, a report by UWS and Oxfam and another from Carers Trust Scotland, which were both based in Scotland. But I won't say much about the contents of those because that is really similar to the results in Becca's earlier presentation today. More important information I got was from a Scottish Government Health and Wellbeing survey that was carried out in schools earlier this year. Primary 7 to 6 years were asked if they had a caring responsibility and what was the frequency of their caring. Not only did this give us really great detailed comparisons of young carers and their peers on every question, it also provided feedback from a hidden population of carers. So we know we've got a really high hidden population of young carers in South Ayrshire, and the ratio 1 to 5, which has been bandied about already this morning, of young carers in a class, we actually found from this survey that it's closer to 1 in 3, and from speaking to counterparts and other local authorities, they're finding the same. Going forward, we'll also have direction and input from a new group of young carers, currently called the Young Carers Voice Group, but I'm hoping that the young people can come up with a catchier name than that. So that'll be a group of young carers aged 5 to 18 from across South Ayrshire, and they'll direct our priorities and actions going forward. So next slide, please. So physical fun and activities. My slides look much prettier than this. I'm not sure what's happened. So various questions and answers from the Health and Wellbeing survey indicated that young carers had less time spent outdoors, exercising, they had less interest in new things, they felt lonely, their number of friends was significantly lower than their peers who didn't have caring responsibilities. So I have worked with schools, our Active Schools team and Knowing Scotland, and we've been able to offer various activities, and we've done this during the school day. We know that a lot of our young carers can't participate in extracurricular activities or school trips, so it was really important for us to give them these opportunities during the school day. As you can see from the pictures, we've done amazing things, rowing on the River Aire, we've done archery, some young people went caving under Culzean Castle, and we've got whole days out at Dolphin House, which is our outdoor activity residential centre in South Ayrshire, with young carers, bringing together lots of young carers from various schools across South Ayrshire. So a great opportunity for them to make new friends and get peer support. The feedback's been great. The children have loved being outdoors, getting fresh air, getting physical exercise, but as well as that, all of the activities that we've been doing provided mindfulness and benefited their mental well-being as well. So in addition to this, we have an Activate card in South Ayrshire. So this is offered to all young carers, and it provides access to all council-owned leisure facilities. So that includes swimming pools, gyms, golf courses, and it also gives access to lessons for free. So that includes swimming lessons, diving lessons, and gymnastics lessons. From January next year, our under 8s will be able to take someone for free, and also from January next year, we'll be extending this offer to our young adult carers. We got feedback from them that they were paying quite a lot of money for gym memberships, so they'll be able to access our gyms for free. Next slide, please. Our self-care club, our health and wellbeing survey data showed significantly poorer wellbeing scores across all measures for young carers. And mental and physical health are intrinsically linked. So I worked in partnership with colleagues from NHS Ayrshire and Arran, who provided support for mental health, and Active Schools, who provided support for physical health. So initially we consulted with a group of young carers of various ages. We wanted to understand what their barriers and challenges were, what they do currently to support their physical and mental well-being, what could help and what could we do to help them. The result of the consultation was that they would like additional strategies to manage their mental and physical health and well-being, and support to implement those strategies. So that might be things like some Bluetooth earphones so that they could listen to music, or maybe a voucher for Costa to spend time with friends, as well as things like a fidget toy and a squishy. So the outcome was, which we piloted last week, the self-care club, which the young carers named themselves. So we have created a one-day event which young carers will attend. This will consist of team building activities to help build a peer network and make new friends. There's an interactive and fun course on mental health strategies, includes understanding all about mental health and different strategies that the young people can put in place to manage this. It's actually a certified course. It's a train the trainer course. So all of the young carers who attend will gain a qualification, and then hopefully they can move on to share that knowledge and understanding with their peers to support them. It would also help our young carers who are supporting someone with a mental health condition, giving them strategies to manage that. And our ultimate goal would be to have the young carers facilitate the self-care club days in future, but we'll need to build up on this. We also provided ideas for physical activities that could be carried out at home or round about their caring role, and we created a goodie bag to take away. So this will include lots of information on physical and mental health strategies, ideas and things that would support them. It's been designed by the young carers and will contain things like chocolate, stress balls, Bluetooth earphones, vouchers, a journal notebook, and other bits and pieces. I'm delighted to see the pilot was a great success and really positive feedback from the young people, and we're going to make this available to all of our young carers from January 2023. Next slide, please. So awareness, this is another video. I've loved seeing everyone's videos this morning. We have been working with a group of young carers since the summer. The feedback was that they wanted to improve understanding with staff and also with their peers about the impact of their caring responsibilities. This kind of goes in line with a survey that I carried out not long after I started in this role, which I had almost 800 responses from education staff across primary and secondary schools, and that really highlighted a gap in knowledge with common misconceptions and misunderstandings in relation to young carers. So we decided to make a video. The young carers worked with a production company, and they have told their stories. They have written the scripts, they have learned how to operate the camera equipment, the sound equipment, and unlikely I thought at the start, they have all been acting in it as well. We actually last night showed the children the video for the first time, and it was absolutely fantastic. I can't wait till the editing's finished, and then we'll be able to share it all with you. So we're going to use this video. Initially it was planned only to use with secondary schools, but it's so impactful that we're going to use this for practitioners as well to raise awareness and help understanding of young carers and the impact for them. I'll move on to the next slide, please. So stress was highlighted in our local health and wellbeing survey, and I can't take the credit for this initial idea. I actually got it from Perth and Kinross, who spoke about a very successful project they had funded by the National Lottery at a Carers Trust Scotland event. So the Carer Service in Perth and Kinross ran this project for 3 years, funded by the National Lottery, providing one-to-one tutors for young carers online. And there was great feedback from the young people, from the families and from their education staff, and it was actually so successful that the council took on funding it full time. So Perth and Kinross really kindly shared their business plan, which we are aiming to replicate in South Ayrshire, but with a zero cost. So we are working with a local university, the University of the West of Scotland, and students who are studying to become teachers. And we have students who have volunteered to be matched to a pupil and a teacher one-to-one and commit 1 hour a week to working with that pupil. The class teacher will provide the work and the student will then feed back to the class teacher following the session. The sessions will take place online and in person, and students will tutor from primary 1 up to Nat 5 level, so that's about ages 4 to 16. So we're not asking the students to do this for free. So in exchange for their volunteering, we will support them to achieve accredited certification through our youth work department. And obviously that's dependent on age, and we'll provide a reference detailing the work on the project, which will hopefully be really beneficial to them in the current tricky job market for teachers. In addition, the students can participate in UWS's volunteering award. We've already had lots of volunteers from the university, and we're beginning to match students and pupils. So I've got no results to feedback at the moment, but the initial feedback from schools that this has been offered has been fantastic. I can finish there. I think it's been great to see everyone this morning. What I've really learned over the past 7 and a bit months is sharing knowledge and practice with other areas has been so incredibly beneficial. And don't be afraid to ask. As we say in Scotland, shy bairns get no sweeties, so that's kind of translated as shy children get no sweets. And I've been doing a lot of awareness raising activities across South Ayrshire with a variety of organisations and services, and what I've done is asked, when I've done that, what can you do, what can you offer us, and what can you do to support young carers? And I've actually been blown away by the variety of support and activities that have been offered by really unlikely people. And like it's been said throughout all the presentations this morning, partnership working is absolutely key. Thank you very much. I'll take any questions in the comments.
Thanks ever so much, Claire, and completely agree. I think we're just seeing so many sort of partnership opportunities development. You mentioned about universities. I know there's been a lot of really positive proactive work with universities up in Scotland. I think in the next year, there's going to be much more work in England around universities and young carers from that sense. We heard about sports clubs earlier, so that's been really great to hear. And I think also you mentioned the example about access to leisure activities like gyms and things like that. Again, there are different examples which we're seeing of that as well. That's working really well, where sort of leisure centres are linking up with their young carers provider to be able to offer discounts or free access from that perspective as well. So thanks ever so much for joining. Really appreciate it. If I have next slide, please, Belinda. And on that sort of sharing practice and sort of partnerships and learning from others sort of message, I'm going to hand over now for the final presentation of the session, and I'm even more grateful than all the other speakers for Melinda, and that's for one reason and one reason only, and that's because it's actually the early hours of the morning for Melinda. So I'm so grateful for Melinda agreeing. I was chancing my luck when I said, would you be interested? Melinda kindly said yes, she'd be more than happy to. So Melinda's going to come and just share about a specific education and support program that they've been developing and recently sort of rolling out in South Africa as well, just to again share some of that learning about different ways to support health and well-being for young carers. So thank you ever so much, Melinda. I'll hand over to you.
Absolutely, it's an honor to be here. Yes, the sun isn't quite up here in the US where I live, so I'm still in the dark, but I am absolutely thrilled to be here. I am just bowled over by the amount of work that is being done in the UK. I envy all of it. So yes, I'm thrilled to be here. I'm going to talk very fast. Hopefully, I'm notorious for having far too many slides. I'm happy to share as many information, bits, slides, whatnot, with anybody who would like moving forward. I'm going to talk about a program that we developed here in the United States called Y-Care. It's a youth caregiving training support education program. And I'm particularly excited to share it with all of you amazing folks on this call, because I'm going to talk about how we adapted it to the South African context. But what I really want to be able to highlight is the fact that it's absolutely adaptable to any culture, demographic, geographic region. So thrilled to be able to talk about maybe how we could adapt it there in the UK. Next slide, please, Belinda. I can't go any further without highlighting the extraordinary team, all of the ALS and MND organizations, the universities there in South Africa. Thank you, they're just extraordinary. Next slide, please. So to situate it a little bit, so this was originally created in the ALS motor neuron disease population, primarily because my clinical expertise is in neurology. So I've often worked in lots of complex and difficult to care for disorders. So ALS motor neuron disease being one of them. This is data from the US that really informed our next steps, which is absolutely, as you all know, children and youth are deeply involved in care. They're often as young as 12, if not younger, and they feel an immense sense of responsibility. Next slide, please. And we did a study in South Africa several years ago, trying to just get a sense of what's going on there with young carers and ALS and MND. And we found, no surprise, the same type of information. But what we really found is that absolutely no one was teaching children and youth what to do. So they were deeply involved in care, but no one was actually giving them the skills. And so next slide. Went back over quite a bit of my data here in the US and did a study where we asked children and youth, how do you know what to do? And we asked them, who's told you what to do? Well, this is a very brief picture of what children say, how they know to provide care. They use common sense, which is disheartening because in this study, children were as young as 8. They just watch and observe. The patient tells them what to do. They kind of figure it out. In all, in research over almost 300 children and youth, 70% had no actual guidance or training in the actual skill that they were using to provide care for a family member across neurological disorders. Next slide, please. So in meeting with my colleagues here at the Medical College of Wisconsin, we talked about how we could create this. And this was a very iterative process. And I'd be happy to talk more and get more questions offline. But we spent lots of time with physical therapy, occupational therapy, respiratory, and speech language pathology, asking them, how do you train caregivers? How could we adapt this to children and youth? What are some of the key aspects that need to be included? And you'll see we did many, many tests. And the photos at the bottom show you kind of our results. Like when we're working with the children and youth, you'll see that they're actually able to try out different equipment guided by those respiratory therapists. They're using power and electric chairs guided by assistive technologists. They're understanding how to communicate with their eyes. We know that with ALS, one of the last or one of the only things that are not affected by the disease is your eyes. So it's an opportunity for children to understand how to help their parent communicate with their eyes. And then in the end, you'll see that we did food prep and feeding so that children really work with dietitians and speech language pathologists to understand how to make sure that those textures are actually good for someone who has some swallowing difficulties. Next slide, please. These are just examples of the publications that we have created and been able to get out there about the Y-Care training. Next slide, please. And this is the final modules, but you'll see that they are in very specific setup modules, and they can be switched out depending on the disorder. So this was created for ALS and motor neuron disease, but we've actually tested it in Alzheimer's and related dementias, and we're getting ready to do it now in cancer care. So we can change out the modules to reflect the specific care needs of the person with the illness. And it is peer engaged. Children do these programs in small groups so that they meet other peers, so that they learn from other peers, and that they leave with kind of a peer group, as opposed to feeling so isolated, as many of you alluded to in your earlier wonderful presentations. Next slide, please. But what we wanted to see is how could we adapt it to the South African context, right? Next slide. And there were lots of assumptions based on US context, right? The availability of allied health professionals, durable medical equipment available, understanding what are the cultural differences and assumptions. And there are quite a few in the South African context, particularly around diseases like ALS and motor neuron disease, where there's a lot of assumptions that families were cursed and there were some spiritual issues, which leaves a lot of social isolation in these families. So we received funding in the end of 2019, yes, to go to South Africa and test this out. Next slide, please. So during COVID, while we were all locked in our homes, we created a manual, and it was a really wonderful collaborative effort with the Motor Neuron Disease Association of South Africa, social work faculty at both the Witwatersrand and Stellenbosch University, neurologists, patient advocates, physiotherapists, social workers, all of these extraordinary professionals in South Africa working with me and my team to completely adapt the handbook that we had created for the US context and completely change it and be fewer words, more pictures, really understanding of some cultural and spiritual experiences that the kids are going through. So we did this during the initial COVID lockdown. Next slide, please. After that, once the restrictions were lifted, we spent several months just this past summer in South Africa meeting with clinic staff in both Cape Town and Johannesburg, understanding how can we take this book and work with the children and youth and adapt the program in the South Africa different areas. Next slide, please. And so what you'll see here is that we met with clinic staff, Motor Neuron Disease Association. The bottom slide is all of these amazing patient advocates and they go do homework with families. So they were all trained in the Y-Care model, but we kept adapting it. How do we need to change? Do we need to use different adaptive equipment because of the lack of access to a lot of the durable medical equipment? What kinds of languages do we need to do? How do we need to engage these families? And so this was probably the most critical piece because it was deeply involved with all of these healthcare providers who are themselves going to be delivered the Y-Care model. Next slide, please. So we actually did 3 sessions, 2 in Cape Town and 1 in Johannesburg. You'll see these are all of our amazing healthcare providers and some of the children and youth at the top. We ended up training 27 youth and 4 adults. That was another tweak. In the US, we don't ever have the parent involved in order to give the child that time to really have that peer engagement. But in South Africa, there's no adult caregiver education programs as well. So the adults asked, and it was wonderful to have them involved. Next slide, please. So this is some of the feedback from the healthcare providers and the youth themselves. The youth said that they loved the basic care. They really, really needed to understand all of those hands-on basic care, turning, transferring, lifting, because they don't have different devices. They're just using their own backs and their own body weights. So working with the therapist to be able to understand how to do that was amazing. The low-tech communication boards, they really, really needed that. They don't have access to a lot of high-tech speech generating or communicating devices. So just making simple boards with alphabets and pictures. After the session, we got some feedback from the families that the children and youth went home and were teaching everybody in the family better ways to do lots of care. What was also interesting, you'll see in this picture here, we have the book out and kids took so many notes. They drew pictures, they circled, because in this handbook, everything that we talk about is in the handbook so that they can see what they did. They can ask questions. It's all of the detail is in there. The therapist, we always bring in a physician to talk about motor neuron disease, and the therapist asked if they could do that right at the beginning and not over lunch as we used to, which was wonderful because it really set the stage, answered the kids' questions right at the beginning. We had so many questions about transferring bed sores, wound care, because of the lack of engagement in community, a lot of assumptions around being cursed and cultural misunderstandings around what ALS is. We needed to have much more discussion around bed care and transferring. And then the patient advisors were absolutely phenomenal and were completely able to provide this training without the need for some of our speech or physical or occupational therapists, which were really hard to come by, actually. Next slide, please. So when we think about sustainability, the whole goal of this project was capacity building and sustainability. And we really showed that we could build the capacity, particularly in the Motor Neuron Disease Association, the patient care advisors. The sustainability really spoke to that as well. The need to be able to do these kinds of trainings in the community, as opposed to requiring the families to go somewhere like to the hospital or to a church. The fact that it was very difficult to get therapists, but that our ability to really rely on these patient care advisors or home health workers, and to show that we can do that and that other settings can also do that as well, is really critical. And then making sure that we really engage the whole family. So again, in the US, this was created as a young carer, youth caregiving program, but really understanding that in different contexts, we have to engage the entire family, and that's going to help towards sustainability. Next slide, please. We are in the process of translating the book into isiZulu. We're also, you'll see this is a graphic novel that I wrote several years ago for children and youth to really understand what is ALS, what is, how do I talk to other kids about it? There's a whole section in this book on caregiving and being a caregiver. There's also a very, the end of the book really talks in depthly about death and dying. So we're also translating that book into isiZulu. The graphic novel has already been translated into French and German and Italian and Dutch and Spanish. So isiZulu will be a wonderful addition. Next slide, please. And that is it. I feel like I have talked incredibly fast. My apologies if I talked too fast. I would love to answer any and all questions in the chat or offline. I can't thank this amazing team enough in South Africa, the families, all of the universities and the clinics. Next slide, please. And then this is my contact information. Absolutely happy to answer any questions about YCare and adapting to the UK context. So. Thank you. I hope I didn't go over, Andy.
No, you did absolutely brilliantly. Thank you ever so much. And thank you again for joining in the early hours of the morning. I think it was really, I was so keen to just get this completely different perspective. Because I think it's very, I think in the UK and in England, where we've got this focus on preventing inappropriate excessive care, there's a setup and there's a social care system to help with that. Whereas actually very mindful in other countries, there isn't that social support network to help in terms of from that sense. So there's a really interesting concept around some of those practical skills and training for young people as well from that sense. So thank you ever so much.
Thank you.
Slide, Linda. So we will have hopefully have some time just if there are any questions before we finish. But as I said, in terms of slides, we'll be going around with everyone's contact details on from the speakers today. So I just want to finish by promoting the Young Carers and Young Adult Carers Pledge that is being launched today on Carers' Rights Day. So as many of you have heard or may know and have heard today, young carers and young adult carers have actually had a series of legal rights and sort of policy sort of provision over the past decade. So in total, there are more than 10 different sources of rights or expectations for young carers and young adult carers, ranging from a right to a young carers assessment, to transitions assessments, to all staff having awareness of the needs of young carers, to involvement in hospital discharge. But what we're finding, so research from the Children's Commissioner back in 2016 and then the Children's Society back in 2018, really suggests that these rights are not consistently being implemented. And so what we're doing as part of the Young Carers Alliance is we're asking organisations and individuals to pledge their support to help ensure that these existing rights become a reality for all young carers and young adult carers. So the Young Carers and Young Adult Carers Pledge is being launched today. It focuses on 8 principles, which are all about consolidating what should be in place based on existing legislation and policy. So there is a link in the chat there. It's really simple, caringtogether.org/Young Carers Pledge. I'm just going to go through the 8 principles, but just to say in terms of the plan for them, as part of the Young Carers Alliance, we've done the specific asks to go to the all-party parliamentary group for carers and for young carers. And we're also going to be producing in the next week a letter that organisations and individuals can send to their local MPs, asking them to support the pledge as well from that perspective. So please do, if you're signed up to the Young Carers Alliance, look out for that. If you're not signed up, the final slide will tell you how. But I'm just going to go through the sort of the principles for you now, just to see so you know what it is we're asking for from that sense. Next slide, please, Belinda. So you can see, so these are the first 4 here. So the first and foremost being that every young carer should know and understand that they have legal rights and how to access their rights. So at the Young Carers Festival in England back in June, I did a consultation, really simple, with nearly 200 young carers, and the vast majority of them did not know either that they had legal rights, or if they heard that they had rights, they didn't know what they were or how they'd access them. There was only a very small minority of young carers who knew what their legal rights were and how they could benefit them in their local area as well. And then you'll see as you go through the principles, these are things that are coming up in the legislation. So that no child or young person should be providing inappropriate or excessive levels of care that's impacting on their health, well-being, education, development or childhood. Again, we've heard some really great examples today of some of the proactive work that's been going on around identification of young carers, but we know there is an element of a postcode lottery, and there shouldn't be. Every local authority has a duty to be taking proactive steps to identify who young carers are in their area. So again, this is asking for that to make sure it's happening no matter where young carers live. And again, we've heard in previous sessions and also today about some of the impacts on young adult carers as they approach adulthood. So again, there should be support for them to make a successful transition into adulthood as well. Next slide, please. And then again, the final 4 principles. So again, so as you saw in the chat earlier, from January, every single so young carers are being added to the school census for the first time. So this is a data collection return that takes place in England 3 times a year. And in the English school census, young carers are for the first time being added. And that, alongside with statutory guidance that says that all school staff should have an awareness of young carers and a designated safeguarding lead should have particular knowledge, actually is a really good opportunity to improve the awareness and support for young carers within school, but also college and university as well from that perspective. Similarly, UCAS for the first time are enabling people to declare that they have caring responsibilities. So from next spring, we will for the first time have a much better idea of how many young carers are identified in schools, how many young carers are identified within universities, and how many young carers there are nationally when we get the results of the census, which are due out on the 19th of January is a current preliminary date for that one. And so on a result of that, all schools should be proactively seeking to identify who their young carers are. You heard from Kelly up in Manchester earlier, where they've got nearly 150 young carers champions within their schools. Again, in Cambridge and Peterborough, Centre 33 have been doing a lot of work, and they've got around 75% of their schools who have already got young carers champions or signed up to one in place in that sense as well. We've talked a lot today around that join up between children and adults. So actually many young carers are caring for adults. And so actually that's where you need to have that joined up work between children and adult social care services to really get that whole family approach. Because I think what we're not really clear about is how well is that happening in practice? How well is children's services and adult services linking up around young care identification and support and reducing some of that inappropriate and excessive levels of care from that perspective. And that work should also include the wider partners. So the voluntary sector have got a key role to play if they are young carers providers or other, say, mental health providers as well from that sense. And also earlier you heard this morning from Becky about the Health and Care Act and about the duties in relation to health and care boards. So this again is something where they should actively be involving young carers and young adult carers in the planning of services. We've seen integrated care strategies that are being developed. So every integrated care system has to produce a integrated care strategy. First draft has to be done by, I believe it's the 1st of December. It's definitely a December date from that perspective. I believe it's the 1st. And again, we've seen examples where they're not even mentioning young carers at all within sometimes 50, 60, 70 page documents, all about health and well-being from that sense as well. So the pledge is all about trying to ensure that these rights are being reflected in reality from that perspective. So what I would really encourage is for individual organisations on here, you can sign the pledge as well. On that webpage that I'll put the link in the chat to now, is on there you'll see images as well that you can use, to downloadable graphics to show your support, whether as an individual or also as an organisation from that perspective as well. The idea for the pledge, this is based on existing rights. This isn't anything new. This isn't extra things we're asking for young carers and young adult carers. This is about asking for stuff that should already be happening to be happening in practice. What we are going to be working towards is this is really the springboard for the development of a wider covenant for young carers and young adult carers, which is very similar to Care Leavers 1, to the Armed Forces, which is very much aspirational. What are the outcomes that we want to see for every young carer and young adult carer as well? So in the new year, we'll be starting that engagement process to get feedback from those working with young carers, those in local areas, young carers themselves, through different sources, about actually what are the issues, what's working well and what's not working well from that perspective. So please do sign up to the pledge if you feel able to. Again, encourage those, whether it's your local MPs or local authorities or health settings, to show their support as well. If I have the next slide, please, Belinda. So that's everything in terms of substantive for today. Thank you ever so much, everyone, for attending. I hope you found it useful, and a huge thank you to all of our brilliant speakers who covered such a wide range of topics around young carers and health from that perspective. As you can see, the link to the Young Carers Pledge is on the screen there. If any of you are not members of the Young Carers Alliance yet, you can join as an individual or as an organisation. It's free of charge and there are no geographical boundaries. From that sense, we do a weekly bulletin. So please do get in touch if you think we can be of any help at all from that sense. I also just want to say a huge thank you to Belinda, who's done an absolutely sterling job of taking us through over 130 slides this morning. So she's done an absolutely fabulous job as well as presenting herself. So Belinda, if you can just stop sharing now, because we've essentially is 10 minutes for if anyone has got any questions or any comments or observations they want to bring up as well from that perspective. If anyone does have anything they want to say or want to ask or anything, please do feel free to raise your virtual hand or turn your camera on and wave your physical hand around from that perspective. And if we don't, oh, there we go. Janice, did you want to come in there?
Yes, if you don't mind, I'll just share what I've been talking to in the chat.
Yep.
That I think it's time that we had a triangular care type version of best practice, ways of monitoring progress for young carers, to include health, social care, education across all, a multi-agency thing, and develop perhaps with the Children's Commissioner, the big national organisations and the Alliance.
Definitely, it's worth saying, so one of the asks of the all-party parliamentary group for young carers and also for carers is going to be, as a starting point, to ask for a review of how the Health and Care Act is working 1 year on. So obviously it came in July, so that's one of the asks of them, is to ask that question: how is it working, where is it working well, to start collating some of these best practice examples, but also to highlight where it's not being implemented. And similarly, it's also to ask both the Department of Health and Social Care and the Department for Education around how local authorities' duties in relation to Children and Families Act are being implemented, because they came into force, it'll nearly be 8 years ago now, but again, we've never yet had a consistent look at how well is that happening, how many young carers assessments are happening, or anything like that from that perspective. So that's one of the asks that's going through.
Yeah, and do children's services really know the difference between a child in need and the protection guidance and young carers? So, you know, from just local input, I've just heard from a parent carer, for example, that they don't see young carers through the young carers lens, just through the protection lens.
And similarly, we have heard of examples in other local authorities where they said, for example, if there's an adult carer in the household, then any children cannot be young carers from that perspective. And there's no basis for that in terms of either in law or policy from that perspective. Because actually, well, yes, there is an adult carer, but they're also away working 5 days a week from that perspective, or actually they've got their own healthcare needs from that sense. So I think a big part of this work will be to look at actually trying to get some consistency, because actually 8 years on nearly from Children and Families Act, we don't actually have a really clear definition of what constitutes inappropriate or excessive levels of caring from that sense. Similarly, in terms of actually whole family practice, there's a memorandum of understanding. I think again that needs to be refreshed in light of the work around integrated care boards, the role that health have got to play. I'm really great. I can see health colleagues on the call here from that perspective as well. But no, definitely agree, Janice, on that.
Thank you.
So,
great.
Anyone else got any questions? Because if not, I've got planned in terms of, so I mentioned about Young Carers National Voice. So they're a network, as I mentioned, of around 23 young carer organisations across the country who have participation forums. So Caring Together are one of those members. And what they've done as part of their work is they have a campaign each year. And so their campaign in the last year was to create resources aimed at mental health services to improve the identification. So what I'm just going to do, just to finish this up, it's always nice when we've heard such powerful messages from young carers today. So we'll finish the session by hearing from young carers again. So I'm just going to share my screen and show you a film that's been made by members of Young Carers National Voice about some of the work that they've been doing to try and improve the identification and support young carers from health.
Hi, I'm Mia, and I'm part of a group of young people aged 11 to 19 called Young Carers National Voice. We're all about trying to improve the lives of young carers. Everyone in our group provides care for people in our families who have long-term physical or mental illnesses, disabilities, or drug and alcohol issues. And we're not alone. At least 1 in every 12 children and young people are young carers like us. But lots of young people don't realise they're carers, so they have to manage on their own without any support.
To try and raise awareness and help more young carers get identified and get support, our group started in 2020 and is for young carer activists from across the UK who want to get involved in social action and make change. Each year, we decide an issue that is important to us and do a campaign on it together. Our last campaign was all about mental health, because lots of the people we care for have mental illnesses. Being a young carer can affect our mental health too. For our campaign, we decided to create some resources to help mental health services understand more about young carers. We wanted to help them identify more of us in their work, if they're working with the family members we care for, or if we need mental health support for themselves.
So we worked together and created 3 resources which we launched for Young Carers Action Day in March 2022. We made a voice recorded poem about what it's like to be a young carer to help train professionals. We also wrote some template wording to be added to referral forms so they can start asking questions about young carers when people use their services. And we created some simple top tips for mental health workers to help them.
You can find more about all the resources here. You can also find out more about our groups and our campaigns here. The resources we've made have been sent to a lot of mental health services already. We'd love for you to be part of our movement too, so please share them with any mental health professionals that you know. And if you don't know any, you can still help. Just share this video so other people can see it and help our movement grow.
Thank you.
Thank you.
Thank you.
Thank you.
And on that note, I'll let the young carers have the final word and just say a huge thank you to everyone for attending, and hopefully look forward to see people at future Young Carers Alliance events as well. If you're not involved, if you don't get our weekly bulletin, I've put the link in the chat. Please do check it out, and please do get involved, and hope you all have a great rest of Carers' Rights Day. Thanks very much.